At 6:15, I'm going to call the meeting to order. Everyone should be aware that the meeting is being recorded. We're going to start with meeting minutes, and then I have to do some housekeeping. So I'm looking for a motion on these sets of minutes that we have on the agenda here, June 9th and July 12th.
I'll make the motion.
Second.
All right, we have a motion and a second to accept these minutes as presented. Are there any corrections, additions, subtractions, anything, comments? Anybody? You good? I'm good. You good?
I'm good.
All right, then all those in favor say aye.
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 Opposed? All right, motion carries. All right. All right, first thing for housekeeping. This is dated August 15th, 2021. Dear Sean, please accept this letter as my formal resignation from my position as a Hinsdale School Board member effective immediately. After careful consideration, I've accepted a teaching position within our district. Although I am not technically under contract yet, I feel my new position makes it impossible for me to have an unbiased opinion on the tough decisions this board will have to make at the August meeting. I have truly enjoyed being a member of this board over the past 3.5 years and am grateful I had the opportunity to share this journey with all of you. Although I am regretful about my resignation, I am so thankful our district has such a dedicated and passionate group of people making these decisions. I wish you all the best going forward. Sincerely, Kayla Hemlow. So I need a motion to accept the resignation.
I'll make the motion to accept.
I'll second.
All right, any discussion?
Can we make the, can we amend it to make it with regret and Mr. Well?
Sure.
You're all set? All right, so motion and a second to accept with regret, wishing Kayla well. Further discussion? All the favors say aye.
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 Opposed? And Ann, can you put minutes that the board thanks Kayla for her 3.5 years of service. We will miss her and we thank her very much for everything she has done. All right, that's thing one. Thanks. So what I would like to do, if the board is agreeable, we obviously need to talk about reassigning Kayla's committee assignments. We need to talk about the new, because she was the vice chair, so we need to talk about officers. We need to talk about the process we're going to use to replace her until the next election. What I'd like to do is I would like to discuss that all under other business, if everybody is okay with that. Sure. Jim, Julie, you go with that? Kayla's always right here. I'm going to be calling you Kayla for a while. All right, and let's see. The other thing that I want to, the other amendment to the agenda that I want to make is right now, citizens' comments is after the COVID-19 reopening discussion. What I'd like to do is what we did last year. Last year, we had the reopening discussion. The administration presented the plan. The board asked questions of the administration. After the board was done with this question, we opened it up to public comments. We heard all the public comments, and then the board had, each board member had an opportunity to have the floor to state their position before we made the motion and before we made the vote. So it would be administration, us, citizens' comments, and then us again. Is everybody okay with doing that again this time around? Jim, you good?
Yeah.
That works for you?
Yeah.
All right. Then that is what we will do. So you guys all have an updated, this blue book. This is the updated citizen comments that we got through Community Connections. This is stuff that we had over the weekend. So you have everything that we've gotten. You also have 2 late submissions on your desks. So you can add those in with the blue book. And Ann, was there anything else?
I had one anonymous mail that I got yesterday.
So typically we don't take anonymous correspondence. That's been our kind of historical pattern for anonymous submissions. Did you guys want to change that, or did you want to keep that position?
You're gonna go down the line, or-
You can start with you.
I think we should keep keep it that way. I mean, I know sometimes people will send something to each of us anonymously, and then we all read it, but we don't ever talk about it or consider it because it's anonymous. So I
Okay.
think that's been the practice the 12 years I've been on the board. But
Jim?
I reviewed the two new ones that were presented tonight already. I don't have a problem with looking at the anonymous one.
The anonymous one.
I don't have a problem.
Julia?
I don't have a problem with it either.
I actually kind of would prefer to stay with our pattern and not
Which
take anonymous
Yeah, I'm fine
submissions.
either way.
So that's a tie.
Julie said she's fine either way.
I'm fine
By
either
the
way.
way, so then we'll just keep the
Keep it.
anonymous
Yeah, yeah.
submission aside. Let's see. Rule book. Okay, so then let's get on with the agenda items. First up is the Sr2 discussion. Wayne?
So as the board's aware, and hopefully the public has heard about the American Recovery Plan money that came to the school district that was passed by Congress in December. The board started looking at ways in which we could meet the expectation of that grant. And in March, we started talking about it. Of course, we always have public input and always welcome the public in regards to comments on any grants. And I certainly would hope that if there's something that we reviewed tonight that you feel you want to provide input on, just, and if you don't want to do it in the meeting, that's fine. Just call me, send me an email, and I'll try to connect you with the person who might know the most. So the grant, the Recovery Act money was intended to help students who had learning loss because of the COVID year that we spent, actually more than a year, because it was mid-March of 2019 when we went into remote learning mode. And last year, even though we did our best at providing in-person instruction, there were about 20% of our students who did not just did remote. And then there was a lot of students who were in and out for a variety of reasons. So there was some learning loss, and Congress passed the Recovery Act money to help us cover that. There was also, there's very detailed special education law, IDEA, and we were charged by law to provide compensatory ed and to those students catch up. And that's pretty expensive. Luckily, we didn't have to do it out of our funds. So that was the Recovery Act money. We started talking about that in March. And long story short, we're reporting out every month, kind of here's where we are. And we're just starting to spend some of that money. We have until September of 2022. Anything we don't spend out of that grant goes to other school districts in New Hampshire. So at the end, they reallocate it if you don't need it. Well, we felt that we needed it. A lot of it for special education. We allocated about $135,000 for catch up in special education. Some of that was spent over the summer. That grant was approved in early July. So we've actually been able to start spending it. Of course, the state pays us back late. It's a complicated process, which makes our business administrator probably a little frustrated at times. And I'm sure he's in a large group across the country right now with these grants coming in. We had professional development money that we allocated that we haven't spent. So we may go back to the board, even though we draft a grant that says, here's what we think we'd like to do, and the board approves it, and it always, input is always welcome. We may not spend that money. We may find that we really don't need that, in which case we might reallocate that grant. So you can kind of rewrite them every month if you need to. Just need board approval and community input. So we didn't spend that. We have a lot of technology needs that the board agreed to, and so far most of those have come in. We've got laptops for K1 students, all of that money, all the laptops came in, which was a bit of a surprise given the chip issue around the world. And it was 63,000. We had document cameras. We're still 4 that we're looking at. Those are, if you ever have a chance, the camera that looks at a projects on a screen. The teacher then can speak to that, where all the students can see it with one group instead of 20 or 30 or whatever. So those, we got 4 that haven't been in. Smart boards, because of the chip issues, like trying to buy a new car, we ordered them, and Debbie can speak to this in much more detail than I can, but I'm doing the summary. She'll go into the weeds if you need it. So the smart boards, we ordered 3 and we were thought we'd have them by fall. We won't have them until winter. So that's just the delay. Printers, we had 3 and those are installed. So 3 printers paid for out of federal grant funds. Laptop cases, we haven't ordered those yet. We're still trying to figure out if the need is there and if so, what we would use. Offsite backup, we're not there yet. We're working on that. And so the total technology budget was about 106. So we're on schedule though for most of that. A lot of instructional materials that we haven't come down on yet. We have a new director of curriculum instruction and assessment. And so we're kind of looking at that with our professional learning community groups and trying to come up with the best way to spend that. We haven't decided on how to do that yet. We have some stipend money that we haven't procured. We just haven't, by the end of the year, most of our teachers, our staff, they were almost, on that level of, okay, I've had enough for a while. I need a little bit of a break. I don't want to jump right in and do everything over the summer. We did have quite a bit of participation, but not everybody. So we didn't spend all the money we thought we might on summer peak. Copiers, we did, because last year was a lot of remote, and of course, the 3 or 4 months before that, all remote, we were going through copy, getting stuff to students, parents picking it up, and we went many times the number of pages in a copier that we typically go through. We've got those copiers installed. That was about $88,000 for 9 copiers. Then we have a couple of substitute teachers that'll be here every day. So when somebody says, I got a fever, and maybe I have, or I have a sore throat, maybe I have COVID, trying to desperately come up with a sub, which is very difficult to do. We now have permanent subs for the next 2 years, and that'll all be paid out of that federal money. So that's the CARES 2 money. We also have a lot of money that was sanitation spray, sanitation wipes, Clorox, 360, paper towels, COVID custodian being paid for a person who goes around because each day our rooms are clean. Heat wheel upgrades for automation system. We're working on that now. New fogging machine. And we have a facilities committee that meets on Friday. We'll be going through all of this. But I just wanted to give the board kind of an update that we're on schedule with all of that. That was about 103,000. So that kind of gives the quick overview. And if the board has questions, we certainly can go there. September 8th, I would hopefully have a sense of the commitment financially. This was 857 for the SR2. Be able to give you a little better idea of how much of that is spent. But right now I can tell you that we're on track with most of those areas of need that we spoke to in March. And I think we finalized that in April.
Okay. Any questions for Wayne? No. Jim?
No.
You good? All right. Do you want to just segue right into SR3?
So SR3 was the American Rescue Plan, and that came out of Congress in winter, although it didn't really get approved until March, April. It depends on how you look at that. But that was a bigger amount of money, and those funds need to be spent by September 2023. So if you have some ideas, once again, catch-up learning, supporting teachers, making sure that we have our special education needs met, making sure that we have clean air, clean filters, that we've got airflow. I mean, all those kinds of things are all part of SR3, just as most of those were part of SR2. So after SR3 has been submitted, we submitted it actually in July. There are some issues at the end. 2/3 of the money for SR3 have come from the feds to the state. States having a little bit of trouble with free reduced lunch numbers in order to get the exact allocation. But so far, it looks like our submittal will be approved, but can't say anything yet until we get it all done. So we've got a couple of things going. We've got a commitment with Jaffrey Range District and Keene State College around leadership training of our staff, existing Hinsdale staff. So those PD funds that might come from the district budget will be coming from that fund. We've got a first class for these students in mid-September. We have the social emotional learning piece. We have PD days at the beginning of the year for workshop days for teachers. We have someone from Ceresk, Eric Mann, we've been working with for a long time, who will be working directly with our teachers. So we're using some of this money on our workshop days to provide high-level expertise for all our staff, not paid for out of district funds. So that's all the good stuff. After-school tutoring program, we're still working on that in Lake Bus. We've got that lined up. Of course, we haven't spent any of this money yet. And we don't have the need to start spending it until after the first day of August 31st. We've got a literacy coach or a literacy interventionist and a math interventionist at the high school, middle school, all lined up. We're still working at the elementary school, but I think we have a reading coach lined up, and I think we're pretty close to the math coach. Mr. Bogio is not here today. This is like first vacation's taken in 18 months, so it'll let him go, get a break before school starts. We've got more money for social emotional learning. Library books haven't been purchased yet. We had 2,000 for that. Network upgrades, we're still working on that. Books for reading support at home, we're still looking at that. So most of this, since we just got the approval or just got the submitted, and just got the okay that we'll have about 2/3 available, and then the other third will come later. So this is kind of in process. We won't be spending it yet and haven't spent it yet, but down the road. So if there's still something you're thinking, I know what students need to catch up. We're trying to reach out to homes. We're trying to support, extra books. We're trying to make sure that the lunch program can accommodate all the needs. We're trying to make sure that we're kind of building up our social emotional learning side as well as our academic side so kids catch up. A lot of kids didn't get everything they needed over the past 18 months. So that's kind of a quick, we do have an accountant in here for grant accountant, which we haven't hired because our current business administrator is managing both the grants and and we have a grant manager who we are paying who kind of manages these grants, and all of that's being paid out of the grant. And we have indirect funds to help supplement what goes through our business office and all the other stuff that we do. So the grants are helping to support the funding, supporting the actual implementation of the grant. So that's just a lot of what's happening with that. And I know that we're not there as far as spending ESSER3 yet, but if the board has any questions, be happy. And once again, public, if you've got a comment, concern, question you want to bring up in public input tonight, or if you want to email me or call me, I'm happy to get the input. The more input we get from the community, the better.
Questions for Wayne, Holly?
No.
Jim? Julia? Okay. All right, let's move on to the discussion of the joint meeting with the Selectmen and the school board. The Selectmen would like to get together to have a joint meeting with all of us together sometime in September. I've been talking to the chair of the Select, and we're looking at things like the CIPs for the town school, looking to see that, where these various projects are, so we can kind of coordinate, not hit the taxpayer with any multiple big expenses at one time, kind of even things out, see what's needed. What's the other thing? Talk about the funds balance to see what we can do to buy down tax rates compared with what the Selectmen have. Just kind of touching base to see if we can't coordinate a little bit better to keep everybody on the same page. So I guess the first question is, do you guys want to have that meeting?
Yeah.
Jim?
Yeah, so actually this came at the meeting when I went down to the Selectmen.
Yes,
you.
yep.
Mr. Rideout brought it up, and I told him at that point I didn't think anybody in the board would have a problem doing it.
I can't imagine anyone that would. So.
I would fully support a meeting.
All right, so they want to look at something in September. So if you guys want to, I can try to get some dates together with the Board of Selectmen. I can send those dates to Ann, who can get them out to all of us, and we can kind of compare calendars through Ann and schedule something up. Are you guys fine with that?
Would it be like one of their Monday dates, or are they doing it
Well,
separate dates?
so my personal thought on it is that I don't want to do one of their Monday dates because I don't want our whole board sitting there while they do all their business first. Do you know what I mean?
Yeah.
And vice versa. I don't want them having to sit around while we do all of our business first. So my thought is if we do a separate day where it's, that's our business is, talking together. That seems better to me, but I'm open to whatever you guys might want to do.
I'm okay with that.
Yeah. I'm fine with that.
All right, so I will, let me make myself a note, bear with me. Steve, get dates. All right, so I'll get some dates and we can compare calendars. That's a me thing. All right, anyone have any questions on that? Are we good? Yeah?
Yeah.
All right, so we have to now, let's see, approval of amendments to the emergency plan.
I'd like to ask Ann and Chris if they could lead this conversation.
Absolutely.
Thank you. I think we gave you the information from Dean Jory earlier in the year about what he wanted for amendments, and we've been working on it this summer. And Chris in particular has kind of taken the helm of this. So Chris, if you just want to talk about the amendments we made.
Good evening. So some of the amendments that we have made to the emergency operation plans were separation of the two buildings. That's primarily one of the operational planning strategies from the Department of Homeland Security and the State Committee of New Hampshire would like to see. So we took a section, or I'm sorry, the entire manual and tailored it towards middle high school. I know that Mr. Bogio is working on one for the elementary school as well. So that was one of the primary functions that we focused on. In addition to that, some of the amendments and revisions that we went through, we spent several hours the other day. We added such things from the Department of Homeland Security as external hazard responses, medical and wildfire responses as well. We also updated the SAU staff names. We went through the entire manual, all 166 pages, and pulled out names that were within the manual, so specific names for key leadership positions, and really tailored it towards a position rather than a person. That was under the directive of the Department of Homeland Security, just to try to make it a little more, I guess, broad or able to be filled by a person rather than a specific individual.
Yep.
So we went through that. We updated emergency drills and to reflect for this coming school year. So we went back, we looked at historical data, we made sure all of the past drills were updated in the manual. We also updated emergency contacts, and we are in the process of getting it signed off on. So.
Anyone have any questions for Chris or Ann?
So this actually came up in the facility meetings a couple of times, I believe. My understanding, it has to be filed with the state by the 2nd of September.
First.
Right.
So it's an electronic submission. If you don't change it, you just let them know there are no changes, but we have modified it based on what they
Yeah.
recommended. So we'll submit the changes once we get the signature page, and that will go in.
So I think you need a board vote to approve the revision.
And there are in total copies available if you'd like to see it. I know we made, they're not for public consumption, but the board should look at it.
I don't have a question, but I just
Yeah,
have a
go ahead.
comment. So I'm still on it to access the teams from the years that I was chair. I don't know if that one's, you want to switch that to Sean. It hasn't come up, so I didn't really think about it until this,
No, thank
that
you.
was in the packet, and I looked up, I logged in the teams, and I was like, oh, it's one of the teams that I'm in, so. I mean, it's not a problem because I'm on the board.
Right,
Right.
Sean should be it.
Yeah. but
Thank
it's
you.
fine.
Thank you.
Okay, so what is the process then for review and approval? Is that going to be submitted to us or?
So do you want to, so what they do is they, made a list of the stuff that was updated. Do you want those pages? I think, didn't you say you have those pages printed?
We have 3 notebooks with everything in it, but you can, which those are.
Okay, do we need to do that tonight or like, again, let's
When does it need to be in?
September 1st.
September 1st, so we kind of do need to do it.
And I have to get fire chief signature. I have to get a lot of signatures. so.
Okay.
So my plan was originally to discuss it at the facility meeting this Friday, but make a recommendation, but obviously that time frame is not gonna
Well,
work.
so let's see, so Friday is 2 days away, right? So you could do a motion to approve and have me sign it contingent on review at the facilities committee, because I'm gonna be there like right after you're done to do personnel, so I can still sign it.
Okay.
Yeah, I'm good with that.
Are you gonna be there on Friday?
Yeah,
Okay,
and I'll
so
be at
that's-
both the personnel
that's-
and facilities meetings.
Yeah. So you could do that, and that would give you some time to, talk about it at facilities if you want to take one of the books ahead of time, because you're chair of that committee.
Yeah.
You can look at it, and that way it'd be contingent. So if, facilities had a problem, you guys could work it out, and then I'd be okay to sign after you guys reviewed it.
Okay, and how do we get Holly's?
Well, if I
It's-
vote the motion to, how. to
It's
get my
just
signature,
a,
it's
so,
just
so
your
there,
signature.
yeah, it's the superintendent and the school
Oh,
board
okay,
chair.
all right, wonderful.
Yeah.
No. So,
All
all
right, so that works.
right, so then I would need someone to make that motion.
I'll make it,
Okay.
motion to approve the changes contingent upon the.
Review at facilities, and after that, the
the
board can decide, chair can sign.
Yeah, I'll make that.
All right, so there's, all right, motion and a second. Any questions, concerns, comments?
No, that's
Nope.
perfect.
All those in favor say aye.
Aye.
Opposed? All right, motion carries.
Thank you.
All right, let me see. Approval, minutes, emergency plan, review and approve the DOE 25. I'm assuming that you, Tom, or is Wayne gonna start off, or?
I have put the copy of the DOE 25 in the packet
Yep.
for your review. There is a process of signing by the superintendent, the board chair, and majority of school board members a cover page for both the DOE 25 report, which goes to the Department of Education, and the MS 25 report has a separate signature page that goes to the Department of Revenue Administration. These reports reflect the business operations, the financial results of the school district for fiscal year 2021.
Does anyone have any questions for Tom? Jim, you good?
I'm good.
Okay, Joe, you good? All right, so then we need a motion to approve.
Second,
Motion and a second to approve the DOE 25. Any discussion? All those in favor say aye.
Aye.
Opposed? Motion carries. All right, then we have the motion to approve, I always get their names wrong, Vashon Bouquet and Company.
Awesome.
Thanks, Tom, for 2020, 2021 audit.
I'll make the motion.
Motion and a second to approve the audit. Questions, comments, concerns? Nothing? All those in favor say aye.
Aye.
Opposed? Motion carries. All right, then we have the review of the letter from the Hinsdale Federation of Teachers Union. Did everyone get that?
Yep.
That would be. Let's see, there's board business, then that, then the signature page is in the back of the signature page. Is that it? No, it's right here. Maybe it's not. Basically, it's a contract year, so the union is looking to negotiate a new contract. So Wayne, remind me, what is the process that we need to do? We need to accept the letter?
You could accept the letter.
Yep.
It's all it is for your information. And then I would suggest that personnel, and I know you're meeting on
Friday, yep.
begin to set some dates, looking ahead and talking about, and then starting to kind of think about the areas that you might want in discussion during negotiations. And we've got, basically have several months to make all this happen, but I think they would like to begin conversation relative to date and schedule calendars.
Yeah, I'd like to start that sooner rather than later personally, but
And
Holly?
any board member, look through the CBA, any board member can suggest something personnel if they see something that then, So it's not just, it's us.
Oh, it's everybody.
reading,
Yep, it's everybody. All right, so I need a motion to accept the letter from the union and then for personnel to start setting up dates.
I make the motion.
Second,
All right, motion in a second. Questions, comments? All those in favor say aye.
Aye.
Opposed? Motion carries. Discussion of goal setting date. At the last meeting, Wayne and I were supposed to get together and talk about some dates, but that just didn't happen. There was just too much stuff going on. So what did you guys want to do as far as discussion of a goal setting date? Because I am having a hard time wrapping my head around available dates to do that.
Sean, we did come up with two dates. That were
Wednesdays?
Possible, Wednesday, the 22nd of September and the 29th of September. Those
Yeah.
dates would work. They
When-
work for the board.
Wednesdays are not great dates for me. That doesn't mean I can't do it, but Wednesdays aren't great for you either. Um,
I'd recommend personnel look at some other recommended dates on Friday and then we'll,
Do you want to table it and then have personnel handle it
yeah, I would.
on Friday?
personnel handle the goal setting?
No,
No, the dates.
the dates. We'll get some dates together and email them out.
Oh, you mean because you're gonna be with Morris?
Because we'll have the personnel committee there together so we can think about some dates.
Oh, you just look at your dates that you're coming
Yeah,
up with.
Well,
Okay.
that's what Wayne's, the personnel do it.
I wasn't following that. I was like, wait, why is personnel picking the date for goal setting?
If you want to throw dates for goal setting right
No,
now,
I-
you can. I just,
Oh, no, I just didn't understand where personnel fit in, but now
Okay.
I follow.
okay.
So,
No, my September's pretty.
yeah,
very
as,
full.
just a reminder to the board that September 8th, in 3 weeks we meet again. So if we had some proposed dates, we could
Right.
come to the board on that day. I could
I'm
talk
okay
to
with that.
admin and maybe we could do something besides a Wednesday.
I'm okay with that.
So we should do a motion to table till September.
I'll make that motion to table.
Second,
All right, motion and a second to table goal setting till the date till September. Questions, comments? All those in favor say aye. Opposed? All right, so that motion carries. Then we have the review of the request concerning outdoor Hinsdale. So that is the same request we've had the last few years, is use of the vans for the outdoor Hinsdale event. This year, I believe Catherine is going to be away, so Sarah Hudon, the program director, would be the driver.
I'll make that motion.
I know, I don't know.
Anyone for that?
Yep, we need a motion for it.
I'll make that motion.
Is there a second?
I'll second.
All right, motion and a second to let the town use the school vans for the outdoor Hinsdale event. Comments, questions, concerns? No? All those in favor say aye.
Aye.
Opposed? All right, motion carries. All right, now we got the big one. All right, so we've got the COVID-19 discussion, the approval of a reopening plan. So I'm just going to start this off by saying that this is, this is the administration's draft. The school board saw this probably a couple hours before it was posted. We've had no discussion on it as of yet. So what we'll do is we'll do the process that we agreed to, earlier in the meeting, where the administration will present the plan, the board will ask questions. After the board has finished their questions, we will then take public comment. Let's see, when public comment is concluded, each board member will have a chance to state their opinion without interruption. And then whatever other conversation ensues from there, we'll entertain a motion and call a vote. Everybody still good with that? All right. Yeah, I'm going to save this for some comments. All right, so Wayne, you want to kick us off?
Sure. So part of the expectation around the ESSER 3 grant was that we come up with a reopening plan that gets kids back into school. We kind of, didn't jump right on that because we could see that the Delta variant had emerged as a topic of conversation, and we didn't, know what that spread might look like and how that might impact our plan. But when we started looking at, in June, we were about 1.5, and we've been like 1.2% positivity, 1.4, 1.5 in Cheshire County. then all of a sudden, we bounce up to 4.1. So we see a trend and we think, okay, now we've got school starting the 31st. We, have an increased community spread. We need to take another look at the expectation. And it was really hard to do because this is 18 months into this. Last June, we don't need masks anymore. And we really thought we had to, conquer this issue as far as those people who were vulnerable. And with the, the vaccines, and we knew that eventually we would have even our younger kids vaccinated. We had about 90% of our staff that we know of that have been vaccinated. And we felt that we had accomplished our goal and was moving forward and could open without, we still planned on socially distant. We obviously have masks on buses because that's a federal law. But we thought we could probably get away with, the extra ventilation we had, the scrubbing and all of that. But then it went from 4.1 until now it's at 8%, which is even higher than the state average. So the positivity rate is higher than I don't know if we've ever had 8%. So we really have an issue around spread. So we got together with the nurses, HR, principals, and said, okay, how can, what can we do with this opening? We knew that the variability is mind-boggling. It seems to change. It depends on the day, and sometimes it depends on which news channel you tune into. You get a different view of where we are. So we decided that probably, and certainly whatever we do, as in always, it can change with new information. But the administration felt that with the information that we had, that our best course of action would be to open wearing masks inside and then not wearing masks outside. We thought that was a message that wouldn't be too hard for people to, okay, here's what we're doing to start. We'll review evidence as it comes in. Board meets every month and they're, proven that they'll call meetings if there's an emergency and reevaluate. They've been very good at communicating to the public. So we know that we can get if things change, we can get a message out fairly quick. So basically the draft proposal, which is just a draft, we knew that you were meeting on the 18th and that still gives us almost 2 weeks to get something together. So the academic recovery, I've spoken to the Sr2 and 3, and we're working hard on that, and that's not going to change. The co-curricular and athletics that are outside, that's not going to be a problem. We have time to work on the plan for indoor sports in the winter. We've cross country right now and soccer. That's that's not going to be a problem to not have masks out there. I don't think we may feel good. The attendance, we keep monitoring that. We had a very good attendance last year. We actually had more students in the middle high than we expected by quite a few. So we were able to maintain our student population, and I think better than most if you compare it. Communication continue to do, and the board's been a huge part of that. Counseling services, we're working hard and trying to help students recover from some of that social emotional deficit. The curriculum, we know we're working with our ESSER money to provide PD and make sure that that we're intervening when needed and identifying those kids through assessments that really need extra help. And now we have literary, we have math and reading interventionists at the high school, middle school. We have math, and reading coach. We're sending some books home. We're doing library books. We're doing a lot there. ELO, we're working with our businesses. All our businesses seem to be coming back that we wanted. And Karen could speak to that in more detail, but it looks like they're happy to work with us. Our students would then, when they're inside, have masks, just like they would in our buildings on our campus. Field trips, when they're in the bus, obviously they have to wear a mask. If the field trips outside, they wouldn't. We're doing 5 days a week, just like we did in 2019. We don't have remote learning, and we don't have that asynchronous, which was extremely difficult to have, for our teachers. Nursing services, we've got a lot more work there because we have to monitor carefully what was concerned about, well, the student may have a sniffles. Now that's magnified many times, so that's much more complicated. We're trying to use more outdoor building space when we can, and obviously ventilation, windows being open, all of that. Section 50, the 504 things we've always had. If a student needs accommodation because of a medical issue, let's say a student had compromised immune system, you know, there, as we always do, there are opportunities for accommodations for students that would help preclude or mitigate the likelihood that they would be exposed to COVID. As I've talked about the social emotional supports, the special education services, we really ramped up the compensatory ed, and we did that because we had this ESSER money. We didn't have it in the budget. Arrival and dismissal, we're following building protocols. I do have the nurse from the elementary school who's online, so she's worked very closely with the principal, and if there's any questions that she would need to speak to, she's prepared to do that. Building sanitation, we continue to wipe everything down every day. We do have one custodian being paid out of COVID funds, out of our ESSER money. We're going to follow the building protocols just as we did last year as far as eating. And I know students don't eat with masks on. We've managed that last year, and we'll continue to manage that. Hand hygiene, focus on that. Playgrounds open for use, no mask. Screening, we're not going to do the get off the bus and figure out if you're temperate. I mean, that was very difficult. We managed it all year, but I don't think it really was of any value to us, but we didn't know that. And then the stay at home, the only thing, you know, we're not doing that if you go out of state, but if you're going out of the country, or if you're jumping on a cruise ship, you know, we won't expect that there would be a quarantine with that. And as in some districts, I read recently about a district in South Florida has 6,000 students in quarantine right now. I mean, so that quarantine though would be only 3 days as the CDC recommends. So we would follow CDC guidelines. I know there's Department of Health and Human Services, and they're always looking at it, but the CDC, the Center for Disease Control and Prevention, which has been ingrained in our minds since the mid-40s. Well, I wasn't around in the mid-40s, but it really got rolling in the mid-40s. People understand, they believe in the metrics that the CDC comes up with. They're well researched. If you look at the studies from the CDC, they're empirical and they're supported with thousands and thousands of cases. So we feel that the CDC is what our community knows. If they were to Google something, they'd probably Google CDC. They wouldn't Google Health and Human Services. So we're confident that that's the metric to go. We totally understand this is complicated and this is comparative advantage. There are downsides in any way we go. We want our kids out of mass. We also want our kids in school. We don't want them quarantined. Certainly don't want them sick. So it's a complicated way of advantages and disadvantages. And we would recommend that we start with masks and certainly understand this is a community decision. And we'll do it, obviously, whatever the community through the board recommends that we do. So I guess that's kind of my quick overview, and you know, Anne can speak to that. Elise can speak to any of the elementary. You know, I think we've got a handle on a start plan, and we'd like to communicate it soon, but we don't have to. We do have to have a plan in motion on the 31st of August. The students will be getting off the bus. We need to make sure they understand the expectations. So that's all I have, unless you have questions.
Oh, we'll have questions. I've been starting down that end, but we start with you, Julie. Okay, Holly, you want to start?
You want to start me? Okay.
Yep.
All right, yeah, I have a couple questions. I have stuff that I want to say, like when we get to after we hear everybody and, you know, incorporate all that in, but I do have a few questions. So since the draft plan was put out, the state, which they didn't do at all last year, the state actually gave us guidance. And that was sent out and sent that out to us last week. I think it came out on the 11th. It's the toolkit from the DHHS, New Hampshire DHHS, which is very similar to the CDC. So some of the stuff, I just have questions based on some of that. So the, like you said, about the CDC and is the one we might mainly follow. And I think we had talked about it last year, also DHHS. And, but I do want to say also that the US DOE, like the New Hampshire DOE hasn't really said anything, but the US Department of Education, I was on as part of my role with the executive board of the NHSBA, I was on a Zoom with US Secretary of Education Miguel Cardona on Monday, and he reiterated that, you know, following their stance is the schools follow the advice of the CDC and their state health agency. So that's from the DOE, and they'll support schools in that. So I just wanted to put that out there. So that's coming from like the very top of the education, Department of Education. But so my specific couple questions are, so last March, we approved a trigger number plan to go remote, because our plan was not a good plan at the time where everything goes remote with one case in the whole district. So, you know, we went back and forth, and nurses in the administration and you know, board members, we kind of like looked at some metrics. And so right now our plan is to go remote when what we are calling high, which our breakdowns are similar to the breakdowns of the state on the state dashboard. So what we're calling high is what they're calling substantial, which is their highest, which we're at for case numbers. But and we haven't hit the percentage. We were saying if it's adjusted for Cheshire County's population, so since we only have 77,000, you take the number you find on the dashboard, multiply it by 0.77. So if we have on that over 77 cases, which today, I think yesterday, I think it was like 100, I wrote it down, 134. So we hit that, but we had a positivity rate of 10%. And now we hit the 8% positivity rate, and school hasn't started yet. So it's not inconceivable that we will hit 10% positivity and go over the case number maybe before school starts, maybe within the first couple of weeks. So what happens? Right, in our plan right now, we're saying go remote for 2 days when we reach that threshold, and close for 2 days and have the kids go remote for deep cleaning. So I guess my question is twofold. Is that still an option to go remote? Because I know the state's gone quite a bit. They ended their mandate to offer remote to anybody who wants it. So is that even possible? It is. Say we go remote, do the deep cleaning, and 2 days we're still at 11, 12%. Like, what happens then? You know what I mean? We're still over the threshold. So I guess we have to look at like what the state guidelines is. And do we need to come up with this a new trigger thing? Are we even going to have a trigger? Does that make sense? My question. Okay.
So I would recommend that we, obviously the trend is from 1% to 4% to 8% as far as positivity. Numbers are going shooting through the roof. So chances are that the trend won't reverse overnight, and it probably won't reverse in the next 2 weeks. And to get a message out that's clean to people, I think it's pretty important. But I do feel that if the board, it would be easy to put together a number as we did last year, to say if this happens and this happens, we're back into remote. What we don't have right now is a remote plan. So remote would not be the same kind of remote that we had. It would be more like everybody's work, maybe we get some book bags or something, but we would need time to put that together, and that would be complicated.
Yeah, because I don't think I have to read it. You know, I've read it through it once or maybe twice, skimmed through the second time, the state guidance, but there is no guidance about, like they do say, you know, if there's clusters, the thing like, you know, that classroom goes remote, or the kids X feet, whether they have masks or not, the feet amount is different. But so I don't know. I mean, that's something I think the board would have to decide. Where last year it was because we were going the whole district remote. We were like, let's make it more reasonable. So are we even going to go remote if there's cases? Are we going to handle it on and I know that's a problem in the middle high school because they mix so much. So I think that's maybe a question we don't have an answer for tonight. You have to work with, you know, talk with the nurses and the rest of the administration. And I only actually have two real questions. So my second question is, in the plan right now, we don't have a physical distancing, number, like last year it was 6, then it changed to 3. The state's recommending 3 feet if they're wearing masks, 6 feet without masks, and if you can't do 3 feet, you layer mitigation strategies. So, you obviously can read it all in there, but, and then there's different pieces for like, gym class and chorus and band and stuff, which, they already, I know band is mostly using the special masks and the belt covers and distance. So, I don't like they'll distance as best as possible. I think that's way too wishy-washy for a written plan. So that's my opinion. So
And I think we agreed to 3 feet, so we would change that if the board agrees
okay.
and keep the 3 feet. Now, sometimes you're in the hallway and kid getting a book out of, so whenever possible, 3 feet.
Okay. So those are my 2 actual questions. I'll have more like other stuff later on in the wrap up. Thank you.
Jim?
That's a tough act to follow. So my understanding is that the governor mandated masks on bus, right? So
That's a federal.
That's
that's
federal.
a federal thing. Okay, so that takes that out of the discussion. That's a given. In our model, what is the lunchroom model for this year?
So
Elementary
I would, if it's okay,
high
if I
school,
could
yeah.
call on Ann, because she's been thinking hard of that, Ann and Chris.
Right.
And then maybe Elise can talk to the elementary.
So in the middle high school, we're trying to keep the cafeteria numbers down to 100 or less. And the kids will be, Mr. Lee and I have looked at it, we can space the kids apart. Most of the kids last year ate in classrooms. We had only 1 class at a time in the lunchroom, but I think this year we'll break it down in a different pattern. So in other words, 8th and 9th grade would eat together in the cafeteria. That would keep the numbers down. Then 6 and 7 would eat the next lunch, and then 10, 11, 12. The 11th and 12th grade numbers are fairly small. So I think we can do it that way and keep kids socially distanced while they eat.
So there'd be a little increased socialization.
There would be a lot more socialization, and especially if we can keep them 3 feet apart instead of 6 feet. I think that's a key thing for students. The students who came in for summer school, we had about 50 kids. They did not wear masks. And when I told them we probably have to wear masks because things were changing, they said, oh, but I said the upside is you can actually work together. Instead of waving each other from 6 feet away, maybe you can actually, collaborate more. And so that was the upside, and they were pleased to hear that. I mean, we didn't build a single robot last year. That's how bad it was. So I think there are some positive aspects to having kids be closer together. They need that. So that's our lunch plan. Our breakfast plan is we will still serve the lunches in advisory. Lunch will be brought, the breakfast will be brought to the advisory classroom, and kids can eat in their small advisories. So we like that model because we served more breakfast last year than ever.
And elementary school.
So if I could ask Elise,
Hi there, can you hear me okay?
Yep.
Thank you.
Good. So I'm going to speak the best I can. Mr. Boggio did a lot of work on this. I know that he was planning to do lunch, have each grade level in the cafeteria, and then have kind of a spaced out, have like schedules for the grades. So each child would be sitting at the table 3 feet distance, and there would only be 1 grade level in the cafeteria at a time. The rest of the children would be in the classrooms, and then there would be a rotating schedule for that. I think that we also liked the idea of children eating breakfast in the classrooms because it made things less hectic for the teachers and the children. So I believe they wanted to keep that plan as it was. But the children would be just with their grade, and they would be spaced 3 feet in distance sitting at the cafeteria tables.
Okay, thank you. In regards to children with their own grade, does that apply to the preschool and after-school programs as well, or have you given that any thought?
I'm not sure exactly what the plan is yet.
Okay, so we need to think about that.
Yeah.
outdoors in terms of athletic activities, gym class and all that, no masks, right?
I mean, student may want to wear a mask.
Yeah,
and we
I'm
certainly
not
would
ma-
allow that.
Yeah, yeah.
Right.
Current
but
plan would say it's no
Not
mask,
mandated.
not mandated, right? They could opt for it. What about the Friday afternoon early dismissal piece that we had last year?
That was part of in
Remote.
order to provide that asynchronous remote and in class, that was to help plan for all of that. So we wouldn't be doing that.
So that's a limit.
That's not-
What about visitors from, outside?
They'd have
visitors
to wear
coming in?
masks.
They would have to wear masks. Okay. But if a parent can come in and
They have to wear a mask.
mess with that. What if a student shows up obviously sick?
So that, I know that the high school, middle school has a little easier time with that, and I guess I would ask Elise to come in again if, last year they had an overflow area, and I don't know exactly what she's doing this year.
Sure. So the recommendations have kind of stayed the same. So the state of New Hampshire didn't put out exact recommendations, but they recommend that we follow the CDC guidelines. If anyone wants to look it up, there's you could just kind of Google CDC school guidelines and you can read everything there. They're recommending that we just stick with what we did last year, which I know was hard on parents, but it's the safest route. So any symptoms of COVID-19, child's asked to stay home. And then if they have the symptoms in school, they'll be sent home. So that's, anything as small as a headache or diarrhea, sniffles, because those are COVID-19 symptoms. And no one under the age of 12 is able to be vaccinated. They're not eligible. So there is no one in the elementary school. None of the children are eligible to be vaccinated. So they're all just at just as high of risk as we were before we had a vaccination.
Okay, so just one point of clarification. So in the elementary school, is there like would they be isolated or?
Yeah, we'd have to put them in the isolation room while they were, this is what we did last year. We had an isolation area and we'd have to isolate them until their pickup person came.
In the middle high school, do we have any sense of a percentage of students vaccinated?
I don't
that any
personally
even-
have a sense of it. I feel like it's like a HIPAA violation to even ask.
Yeah.
So I don't have a sense. I don't know, maybe if
Yeah,
I-
okay.
Yeah,
Mr.
I
does.
think you're
Mhm.
really walking that HIPAA line.
Yeah,
Okay,
Yeah.
all right, so I withdraw that, I withdraw that. And what about kindergarten? Was that half day last year? Was it full day?
Well, we did a couple of things last year, but our intention is full day. So the kindergarten plan would be as it was in 2019.
All right, so again, my apologies for the question regarding the high school.
it's okay.
No, that's fine.
Yeah.
Anything else?
No, that's it.
Not a HIPAA violation, it's fine. Of course, that's okay.
If you don't think it is and you want to ask the question and get
No,
a
no, I don't. I
number from,
withdrew it.
No, I mean, if they don't want to answer it, that's fine, or they don't know, but.
I withdrew it, so it's not even a
Alright.
question.
I wouldn't apologize for it.
no, you don't need to apologize at all.
No,
No,
that's what I
not even at all.
apologize for a question like that.
Julia?
I have a few questions for sure. I understand that on general principle, I am in support of the plan. I think that it's very vague in some areas. For example, home screening procedure, before leaving home, student and staff will complete the following steps. So we're just making that as a recommendation. Is there anything that's going to be followed up? How is that monitored? I mean, it's part of the plan, written in as part of the plan with no real directive of how that's managed. We also talk about have you had close contact, you need to stay home. There's no information or specifics about for how long. We've up until this point been very specific. This is how long you must quarantine, whether at the end of last year, which 3 days. It's very, very vague to stay at home. I as well have a question. I mean, I understand that our goal here is to get everybody back at school and stay in school, and that's been everybody's goal for for a very long time. But we need to have, I feel unprepared for what is happening right now. For if it does not become available for us to stay in school. If, like in March of 2019, we went to town meeting and we're told after the meeting that our school had to be closed. We're not prepared for that, and that concerns me. Our positivity, our number of cases increased 49% in the last 7 days over the previous 7-day average. So it's a scary trend. I am a huge supporter of being in school, and I think that that's the plan that we need to have, and I appreciate that, but I do think we're unprepared for what the reality of what is happening right now with COVID. And so if we get to a point where the governor does mandate, or we get to a point where we have staffing issues like we ran into last year when we had so much staff out, looking, you know, we don't have a plan for how that's going to be handled. And that concerns me.
Okay.
Yeah, that's good for now.
I'm going to kind of mirror your sentiments because I feel a lot of the same things. And I even think that some of the questions that, some, not all, but some of the questions that Holly and Jim asked, I don't feel like we got a very clear answer on. I'm still looking at this like this seems to be so much stuff up in the air. And we're very close to having kids in the building. So I'm concerned. I'm also looking at this plan and I feel like, and I maybe in the minority, I feel like there are things in here that give a very mixed message. You know, we're talking about, you know, masks in school with everybody, and that's fine and dandy. But then field trips are going to resume as normal, and athletics are going to resume as normal. I mean, I think with some, with some restrictions, but we're saying that there's, this substantial, what do they call those levels, like alerts, the community spread,
Transmission.
community transmission. That's the word I was looking for. Sorry, I'm drawing a blank. I'm trying to think of too many things at once. And we're talking about, high levels of community transmission, and we're saying kids are still going to leave this building and go off and do things. And that's not going to expose them, but we're going to have masks in school. And again, I'm not opposed to masks in school, but I feel like there's a very mixed message here. So, that concerns me. When we're talking the communications, how often are we going to be communicating with people? What benchmarks are we going to use? We haven't really worked out we have a communication plan, right? And we can carry that over from last year to this year because it's a decent plan. But, how often are we going to be checking these transmission levels? If we start with masks, I would want to get them out of them as soon as we can, or make it optional as soon as we can. But what benchmarks are we going to use? Are we going to use like what Keene did, which I think is a really good metric, where they have the chart, and if it goes, from this level to this level, it can be optional or however. But there's none of that here. So I'm concerned about that. The stay-at-home requirements, at what point are we going to ask people to get a COVID test, or are we? I mean, or did I just miss that here? So the one question that I got answered was with Holly's question when she asked the physical distancing, because that wasn't here, and we're shooting for 3 feet. So that's great. So I've got one question answered, but I'm looking at all of this here and being this close to school, and I just have a whole ton of questions. I mean, and if anyone wants to speak to any of my concerns, have at it. I will yield the floor.
Mr. Woolridge, this is Elise. I have, I could jump in for something. So,
Great, thanks, Elise.
So you talked about the quarantining and all that stuff that we did last year. So there are very specific guidelines from the state, and I'm sorry you didn't get those. But the state, it wouldn't be our mandate. It's the state's mandate, just like last year. So they have, let's see. So they have guidance for, sorry, I'm just pulling up on my computer right now. So they have guidance for a quarantine guide, a self-observation guide, and an isolation guide. So the quarantine guide is for household contacts who are not fully vaccinated. So that would be all the children in our school because they're not fully vaccinated. If someone in their home has COVID-19, they would need to follow that specific guide. And that talks you through how long you need to stay home and how and when you need to get tested. And it does require a testing. Then there's the self-observation guide. So the self-observation guide is for non-household contacts. So if you
Uh-oh, where's Elise?
Uh-oh, did we lose her?
She's still there. I don't know.
19, you just need to monitor for symptoms as well. And then there's the isolation guide, and that's for people who are diagnosed with COVID-19, and that's unchanged from last year. So I'm assuming that means, let's see, so they need to stay in their home and quarantine for at least 10 days, starting the day of their last exposure. And you can pull those up online, and I'm sorry you didn't get that paperwork.
Oh, I've got hundreds and hundreds and hundreds of pages of paperwork, and I've been reading them for days and days and days, and I've had headaches for days and days and days from eye strain. So what I would like to know for like right now for our stay at home is, I understand the quarantines and all that. So if somebody could just please tell me, is the district itself going to require a COVID test of someone who has been in quarantine at some point or not?
I think we have to because these are state mandates. It's so the restrictions I was just reading to you it's state guidance. So it's kind of out of our hands. So what I would do is just like I did last year is I would call the state of New Hampshire and they would follow up and they would tell us where to go from there, and they would call families as they did last year.
All right, so as far as testing, we're deferring to the state and the state recommendation.
Can I say one thing, Scott?
Well, let me just see if I'm going to get a confirmation of that from Elise.
Yes, that's correct.
All right, thank you. Yes, Holly, go ahead.
If you look in the toolkit, and I only printed off the toolkit, but like on like almost every page, there's links, like they'll talk about stuff, and there's links stuff in here, and I can't find the exact page, but they do talk about quarantining and then stuff with the Health and Human Services contacting them, and there's highlighted links. So if you look at it online, but I mean that's a lot to find it in here and link it and whatever. But just FYI,
I understand.
Oh, I'm just saying.
I
just so
understand
everybody
what you're
can know,
saying,
yeah.
and I understand what Elise is saying. I'm saying that
Needs to be here.
Oh.
one small
Oh.
piece of information, which is
Yeah.
crucially important, is not in our plan.
Yeah, oh, absolutely, 100% agree. I'm just trying to be helpful to say. if
No,
anybody wants to
and I
look it up,
appreciate
it-
that. Thank you.
It is in the toolkit.
Yeah,
so-
I appreciate that.
So that's kind of an easy way to, if someone, I can dig into it and find it just off the toolkit rather than
Mhm.
Googling it. But I 100% agree with you that something like that needs to be spelled out.
Yeah.
Yeah.
Much more detail.
Yeah.
Much more detail. This whole.
That's what I'm saying. And I 100% agree. There's a lot of detail that's lacking. That's all I'm going to do for now. I've got more for later.
Can we have a second question? If one of your
Absolutely.
questions
Ask
sparks
what
a question?
It's a big topic. Ask as many questions as you want.
Yeah, so one of the answers, and then some question that was sparked another question. So I get that, the state's no longer mandating anybody who wants to be remote can be remote. So that's, I think why we said no remote plan. What I don't understand, and I didn't realize or expect to hear this answer tonight, so it surprised me, was if we need to go remote because of cases or, like whatever, why don't we, even for a short period of time, that say if it needs to go remote, why don't we have a plan? Why don't we use, I know last year's plan, everybody was burned out. It was horrible. I've seen it from both sides, but why don't we have that as a plan for if we need it? If, like Julia said, if the state's like, damn, you have to go remote, or we decide on a trigger number and change it and it gets to it, why aren't we doing that? Unless I misheard it. but that's what I thought I heard.
I guess I could do my best to speak to it. Given that the Recovery Act funds are directed at getting kids back in school, we haven't fleshed out, knowing, however, that if we had to pivot, we would do that very quickly, and we have everything in place we had last year, except we have many more computers in the hands of our students. So it's not like we couldn't do it. We would make it happen upon directive. But at this point, our staff is not here to put an administrative piece saying we're going to do this without the buy-in. Would be difficult, but we could get that fairly soon. We could call committees together. I mean, we're meeting with new teachers next Tuesday, regular staff the following week. We have a lot on their plate, but we could rearrange any of that if a remote plan is something that we wanted to look at. Obviously, we could resurrect the previous plan. That wouldn't be a problem. But I think to get the administrators out in front could lessen our opportunity for buy-in and commitment, which we'll all need, and we'll all need to have that commitment based on an agreement that, yes, this is a crisis and the state's mandated we all go remote. I guess I'd like to, I know Ann's thought about this.
I think there's an assumption on our part that that's in our back pocket at all times. We have the technology, we now have the teachers with the skills. It was part of our plan when we chose the Edmonton base program. That's an online social emotional learning curriculum, because we knew at that time that if every kid had those tools, they could still access this at home if they had to, because we feel that's important. So I think it's something assumed was already in our toolkit, so to speak. I don't think it's in this plan because, as Wayne said, this is to get, this whole monies are to get kids back in school. So we have to have this plan to access those monies. So I don't think we were thinking remote in this particular plan.
Yeah,
But
and
it's there.
that's what I thought
Yeah.
it was just assumed in our back pocket that if, like Julie said, if the state does like what they did in
Right.
March of 2020, bam, you're remote,
Yeah.
or something happens and cases spike so much we have to go remote.
Right.
I just assumed we would just
Pivot.
pivot to what we did before, but I thought I heard that wasn't the case, so maybe I misheard, maybe it got whatever, but okay.
I think what changed was we have to ask permission to, if I recall, one of those emergency orders with now, if you're gonna
Oh,
do
I
this, you have
see,
to get
from
the
the state.
permission to do it.
So if we have it, so that's what the brings another question. So this trigger plan that trigger number plan that we instituted in March, and we approved in March, that might not even be doable because we might have to, unless we cleared something like that with the state, right? Okay, so that's another piece for you guys, I guess, have to look into.
Yeah.
Okay,
Mhm.
thank you.
Thanks, Holly.
Yeah.
Anybody have anything else?
Oh, well. After all that, this is like, we
Yeah.
can got more questions up than I had.
Yeah,
already.
one question raises another.
Yeah.
I mean, you have time afterwards also, before a vote.
Okay, yeah,
So
yeah.
you can ask more questions now, you can ask more questions later.
Yeah.
It's totally up to you.
Yeah, I reserve the right to think of, you know what I mean, as we keep going, because you're right. one
We
thing
all-
brings
we all
another and
do.
another.
Yeah.
Yeah, absolutely. Yeah.
Do you have anything else for right now? Jim, do you have anything else for right now?
No.
All right. Ian, have you done the math? Do we know how much time we're gonna have for each citizen for citizen comments?
Want to do that?
Well, we're gonna look at, so I can't,
Well, we've got 43 people online.
and
That doesn't mean they all want to make a comment
Right.
regarding this.
Yeah, I mean,
so,
it's up to, you had 10 minutes allotted to.
oh, yeah, well, no, we're gonna do more than 10 minutes.
Yeah.
10 minutes. 10 minutes is nowhere near enough, so no.
So
The
then
10-minute number's out the window.
a minute per person and then.
And I
Minute?
think that's what we did,
That's what we did for reopening.
Yeah.
All right. So let me see. So 1 minute. All right, so we're gonna move to citizens' comments. I've got some guidelines here. All citizens will have 1 minute in terms of time to speak. All citizens choosing to make a statement will do so in a respectful manner. There will be no slander, name calling, bullying, or threats of any kind. If someone does choose to engage in those actions, we will end citizens' comments immediately for everybody. we have, just so everybody here knows, we have all of the comments that were sent in. We have the various studies and support materials that were sent in, as well as stuff of our own that we have researched. Everybody has this packet. This can be, since we are discussing it tonight in public session, this can be available to you if you want it. You would just need to do a right to know request with Mrs. Diorio. And that's as simple as calling her up and asking for,
Well, it's not
there's
that
a,
way.
there's a form.
There's
There's a form, but basically call her up, tell you want it, and she'll walk you through it. What's not included with the right to know request in that packet is children's names. They have been redacted. Our emergency operations plan that we discussed, that is non-public documents, as well as legal correspondence is also exempt. But if you do want those materials, they are available to you. Okay. So, Ann, do you want to go around?
You want to start here?
I would almost rather start with people who are actually
Okay,
physically here.
I
would agree with that.
Can they state their name first?
Yeah.
State the name for the.
Just ask you to state your name before you start, and we'll start with the gentleman there with the glasses. You, sorry.
Evening, I'm Jason Kolakowski here with my wife, Sarah Kolakowski. We have 3 children, 2 we have adopted from foster care. We care deeply for our children, and the children in general. We are very concerned about the long-term effects of mask wearing on children. Therefore, we created a petition in support of parents' choice. That's not banning masks, that's a parent's choice. Mask wearing on children. By the way, we have received tons of support. We have over 150 signatures of very concerned parents. Overwhelmingly, the majority of people that we talked to supported the petition. Can you give us substantial evidence providing the effectiveness of children as young as 2 wearing masks in school to stop the spread of COVID? Can you provide us concerned parents with significant credible data that statistically proves there was less transmission of COVID in schools which had mask mandates versus schools that didn't?
Your time is up.
Time.
I'd also like to speak. Okay, so I work in a school, and elementary school kids wearing a mask is a joke. They're on the floor, they're stepping on them, they're lifting them during the class, they're carrying toys on them. Then the teachers are having them put it back on their face. Does that make sense? I've seen more kids touch their face this year than I ever have, and I've seen teachers touch their face. So it makes no sense to have little kids wear a mask. I'm also a speech language pathologist, and do you recognize what you're doing to these children with their speech, language, and social skills? The kids aren't hearing the teachers, they're not talking. How do you teach a child articulation skills when they can't see your face, they can't see your mouth make the sounds? You are depriving these children of their speech and language skills, and the social impact of not seeing facial cues, that is ridiculous. And I also want to bring up something bigger, is do you realize that our children face something a lot more serious? 400,000 children go missing every year. Your child is 66,667 times more likely to be abducted by human traffickers than to die of COVID. And you know what the masks do? It helps them to transport your child unidentified and without being noticed. And this is important for us.
Right.
We adopted our child from
Time.
foster care.
Time. All right, next.
Okay.
Yep.
All right. My name is Frances Boucher. I'm a taxpayer of Hinsdale, and I'm a retired health and family and consumer science teacher. I feel the common sense approach is best. Yes, we can pick out individual situations that, as you spoke to, but I really have a deep concern for the elementary school students where if people are not wearing masks, these children are not vaccinated. And, you know, what about the other people that get exposed? I mean, I'm sitting here with a mask on. Do I have to? Maybe I do, maybe I don't, but I don't know if you've been vaccinated or you have or anybody else. And I think it's a shame to be treating our children like lab rats, that, well, let's try it and see who gets COVID first. We don't have time for games. We just don't.
Thank you.
We'll talk fast. Treating our children like lab rats is, to me, kind of like injecting them with experimental drugs with no long-term safety studies.
Your name, please.
Travis Ledoux. Is this virus so novel that we must dismiss decades of science and relevant physics and biology? The former consensus on masks is clear given the fact that we didn't wear them during previous flu seasons. I agree the idea sounds good, but that's the best argument I found. It's a comforting illusion of safety. Your kid can have that safety blanket, but if you can dictate what I put on my kids' mouths, can I dictate what you're shoveling in your kids' mouths for help? Following the precautionary principle, we must consider known and unknown risks to any intervention. There's science showing increased CO2, risk of contracting respiratory viruses, rebreathing expelled toxins and pathogens, psychological issues, and increased stress, which weakens the immune system. 4.2 million children tested for COVID, 0.008% died. That equals 0.00008. Flu threatens them more. Are we going to mask up every flu season? They're not driving this pandemic. There's weak evidence they're transmitting it.
Nina Honeycutt. As far as your SR2 and SR3 things, Wayne, I think we should probably possibly look into something with sort of like a extended school year, but in the afternoons, evenings. There are a lot of children who absolutely were just destroyed last year, like my girls. Both of them went from straight A's and to failing. My 9th grader doesn't even know, or well, she's supposed to be a 9th grader, doesn't know if she's ever going to graduate because she can't take 10th grade English till she passes 9 and can't take them at the same time. So I don't know how or when she's ever going to graduate unless we do some sort of double up thing. We definitely need to have another remote plan in action because it's probably coming back to that. And the whole, I don't know, we're just gonna go back to last year is just awful because it failed so many children. And obviously the teachers, were at their wits' end, but it was a mess.
Sam, do you have any?
Wayne, then clearly this plan was put together for the money. I think it's the parent's choice whether our kid wear a mask or not. This is ridiculous. You guys don't need to tell us how to protect our children. Everybody who can be vaccinated has the opportunity to now, and youngest of children have been the least affected. This isn't good for them. My kids just got over their coughs. Like every day they get out of school and they be coughing. They're miserable with the masks on. And let's try to make school a positive thing again. I mean, they're walking around thinking that everyone's sick and everyone's scared. I mean, it's out of control. It really is. Let us make the decision.
Time's up, Wayne, I'm sorry.
Oh, okay, no,
I didn't think. Wayne,
Yep, Bob.
All right. Now I'm going to go around. It's going to be hard for me to.
Do we get an opportunity to add to the conversation?
No, because we have all these people online that have to. I'm going to go around and I'm just going to ask if you have any questions. I'm going to start this top of my screen for those of you who are in there. Paula Snide. Do you have anything to say?
Hi, can you hear me?
Yeah.
Yeah, so I'm kind of nervous to talk, but I just want to, I can't tell the parents, but my kindergarten kids did not even think about wearing the mask. It was part of their daily routine. I had to remind them to take their masks off when we went outside for recess because it was just part of their day. They didn't complain. If you walked in the halls, you would see that they just wore their mask. They didn't complain. They were more concerned when the playground was closed and they couldn't have free choice and be with each other. The mask was never, in my class, was never an issue. They didn't complain about it at all. And it worries me that if we make it optional, I think that might be really hard for the teachers to to monitor who's supposed to wear a mask. I don't want to wear a mask. I just think that makes it just difficult. I can only speak for myself, and I'm very nervous to talk about that, but I didn't have a problem with the masks and the little ones didn't either. Thank you.
Brian Ebenhausen. April Anderson.
Hi, I have the same concerns as the board's questions had brought up, with having a remote plan and like ready to go kind of thing. I do think the kids, with everything going on in the state and the United States, really, with the spread of this variant, think that the kids should wear masks. I like that it could be fluid and changed as things change. I'm hoping we don't have to go remote because that sucked for everybody. But yeah, I'm for the masks.
Okay, Lindsay Blake.
Hi. Yeah, can you hear me?
Yep.
Okay. I just want to echo what April said too about having something in there about the remote plan. But I also want to say that using numbers of like the children that have contracted COVID or been hospitalized or have passed away, and saying it's not that many, is saying that you're comfortable with like just a few kids have only, and that's really hard to hear because what if yours? What if it's somebody in our community? And that's what we're trying to prevent. And as Mrs. Snide has said, our school community went along just fine wearing masks. And that's what we're trying to do to get our kids back in school, because that's what we all want to see.
Chris.
No, I'm all set. Thank you.
Karen. Karen. Elise, do you have anything to add?
Nothing to add now. Thank you.
Brooke Hayes.
No.
Samantha. Katie Leonard. Heather. Julie Swanson.
No, thank you.
Jody Holmquist.
I just want to say that for the high school, the vast majority of the students had no problem wearing masks. Nobody really likes to, but they are all pretty accommodating and wore them. And I believe that for the safety of our children and our staff, that we should wear masks.
Thank you. iPhone. Alex Duso.
I have nothing to add.
Thank you. Cassie.
I just wanted to say that I worked in preschool last year. And so I worked with the youngest kids in the school, and our kids really did not have a problem wearing masks. And I also agree that it would be too hard on teachers for some kids to be able to wear masks and other kids not to. I agree with parents, and I understand why they want it to be parents' choice, but with 20 other kids in the class, that's not really, it has to be one way or the other, in my opinion.
Thank you. It's all messed up. Melanie Croto.
I'm all set, but thank you.
You're welcome. Mia Summerson.
All set.
Jennifer Leonard.
Yes, so I would just like to say that I can appreciate the situation everyone's in. If given the choice between returning to school and not being remote and my child wearing a mask, I'm going to pick him wearing a mask and returning to school. Remote learning is very challenging. I can appreciate everyone's commentary. However, given that choice, that would be what I'd pick. I would be interested in the remote plan if that does come up, and then readdressing the mask mandate at some point. But I also feel that it's all or none. We should pick one way or the other to kind of reduce any issues. Thank you.
Thank you. Rachel? Here's another iPhone, and I don't know, they keep bouncing around
Yeah.
here. Megan Stone,
I'm all set, thank you.
Valerie Gerard,
I'm all set.
okay. Jess Fleury,
I'm all set, thank you.
Kelly Cruz, Kayla, Jessica Parker, Roxanne Leclerc,
All set, thank you.
Sarah Burgess, iPhone 12, DLF,
I'm all set, thank you.
Donna, Kathy Bean, Julie Fenrich,
I'm all set, thank you.
AQ1W1, Jess Janey,
I didn't know, am I allowed to say something? Because I'm not a citizen of Hinsdale per se, but I do work at the elementary school.
What do you guys want to do? You want to accept? You want to accept? All right, yep.
go ahead,
Okay.
Jess.
Okay, I just wanted to say that I support the administration's plan. And I have to echo what Paula Snide was saying as well. And I just think that the masks did become like a norm for the kids. Nobody liked it, but the staff, and I can only speak for the elementary school, was excellent at providing mask breaks for the kids, and did an excellent job with that.
Thank you. Teresa Fiorio.
Hi there, thank you. So first of all, I just want to thank the administration for their very thought out plan. As a parent first always, and then an employee of the district, I believe the plan to be very thorough and representative of our faculty, parents, and our students. I know that the mask thing seems to be things that people are hung up on, and it might come down to, if we're socially distancing, looking at being 3 feet apart, that maybe in a classroom setting where kids are sitting down, that they're not wearing their mask, but everywhere else in social settings, hallways, et cetera, that they are. And in terms of athletics, I just have to say, I was so pleased. Both my kids participated last year. Everything was very seamless under our administration and our athletic director. So again, thank you for the board for allowing us to speak and having input. I appreciate it.
Heather. I have 2 Heathers on here. Heather Goodwin,
All set, thank you.
Erica Barrett.
All set, thank you.
Okay, I think I have everyone. If I missed someone,
Do you have a hand raised there?
I don't know what that is. I can't.
Yeah.
Hi, Ann. Katie, it's Katie Leonard. Can you hear me?
Okay. Yes, sorry, Katie.
Oh, no problem. My phone crashed when I went to unmute, so I had to get
Okay.
back in. Again, I want to echo what Teresa had to say as well. Thank you to the administration and to the school board for their endless support and always listening to us as an employee. I do support the masks in school for now. And as a PE teacher, you know, we get outside as much as possible. And again, even at the elementary school and at the high school, even middle school, when kids are asking for a mask break, I don't know of many people who have ever said no. We provide them with a good opportunity to remove themselves for just a few minutes and take the masks off. So I am in support of them. And again, thank you to the board and for your endless research. I know you guys have done a lot of hard work, so I appreciate it.
Okay, Karen?
Hi, sorry I missed that last time. I just want to say thank you for hearing me out here. I can see both sides of the coin here. My girls that can be vaccinated are still very, very willing to wear masks in school. Of course, they're high school level. My 8-year-old had a heck of a time last year. It was horrible in the beginning of the year with masks. We're still struggling with that. But when you can get vaccinated, I will do that. I know it's a parent's choice and a kid's choice, but I'm just wondering, like, again, I agree with Mrs. Snide that I think obviously kind of has to be all or nothing in the elementary school. They're not gonna, some doing it and some not masking is not gonna fly. But I'm just wondering, is there a chance, is it possible? I know you guys have done a lot of work already, but is it possible to have some kind of remote plan in place, before school starts in just 10 days? Thank you.
I think that's everyone.
Is that everybody? I just want to quickly circle back to Mrs. Kolakowski. Am I pronouncing that correctly? You said you had a petition?
Yep, with 154 signatures.
Okay, so typically we like to get that stuff, ahead of time. But, we can certainly, if the board is willing to accept that, we can have it in for the record. Is that something everybody's willing to do? I mean, they went through the effort of doing it, so.
Yeah, absolutely, yeah.
Okay.
Just with the, caveat in the record that, we haven't had the chance to look at it or anything like that, you know what I
Okay.
mean? And that, 'cause I know, there's, that to see if there's names on there or not, or someone on.
Sure,
Whatever, yeah,
sure.
just with that note.
Yeah, I mean, and I know, because I had looked at it briefly online once, and there were some anonymous ones, and as we said earlier, we're not really taking the anonymous, but, to have all the, who's that?
On the online one, and then we went around.
Okay, so are you comfortable bringing that up, or? Okay. All right.
Can I ask, is that the only copy, or do you guys have a copy?
No, that's our.
Well, we have.
Do you want us to make a copy
on
of
the
this? You
computer.
guys have a copy?
Yeah.
Okay.
It might be.
Is
better, yeah.
everybody okay if we recess for a second? I can run the copier, or? Okay. All right, we'll just recess for 1 second, just so Ann can make that copy for people, okay? Now you guys are all right with that, right? Yeah. All right. It'll take a minute.
No, I don't think we should have it.
No, I agree 100%.
We're gonna have to talk after that, right?
Seven-thing stretch.
Yeah, this is the time to get up and stretch if you want to. Stretch if you got them.
Debbie, if it's showing red, does that mean the battery's out?
Uh-oh.
Your battery died, yeah. That's a likely story, and oh, my battery.
Yeah, well, Deb's gonna get you a new battery.
At least you have one. Whole box.
Sorry, Dylan.
Hey, Deb. Yeah.
Step away. know.
Does everybody else want to check theirs to make sure they're not red while we stop? Just a luck of the draw there. Kristen. Changed tomorrow. No, mine's red. Yeah.
Are you guys good, or you guys need a minute to do your batteries?
Maybe it's effective, it's still red.
Just to give another minute, because we're updating some batteries, so all the microphones work. All good? All right, does the board want to do additional questions before you do your positions, or do you want to do positions and then do questions afterwards? What do you guys want to do?
Any questions for the admin? Additional questions?
Yeah.
No, I think.
All right.
I'm okay with it.
Do you have any additional questions, Jim?
I don't really.
Julia?
Questions?
No, we're gonna do, like I said, we're gonna do what we did last year and just give everybody uninterrupted time to say their position. Holly, you want to start?
If you want to, if Julia.
Do you want to start?
Okay, whatever.
That doesn't matter.
Then you can start because she started with everything else.
Okay, excellent. First of all, I would like to thank the participants today that came with their comments. I understand this is a very passionate topic for everyone. And I understand that you're here to advocate for your children, which is every parent's top priority. I have 3 children myself. But I do feel like it's fair to state and to make clear, my personal opinion is that we're here, you're here to advocate for your own child and make the best decision you can as a parent. The 4 of us that sit here before you tonight are volunteers that have spent the last 1.5 years feeling an incredible burden to do everything in our power to keep not just your children safe, but everyone else's children safe, our staff, and our community. So our vision has to be a bit broader than what you feel is best for your child, but we certainly appreciate your input, and I appreciate your voicing that and coming to our meeting. I just want to reiterate that this administration and this board, I hope you do realize the amount of how seriously we take these decisions and how much time and angst that has been spent over the last 1.5 years to try to keep everyone in the community safe, as well as just your children.
All set. Jim?
Yeah, I agree with Julia that I appreciate everybody who's here tonight, everybody who spoke online, everybody who submitted a comment or a report or their viewpoints on the issue. Again, it's not an easy issue. As was said, nobody likes the mask situation. I do agree that it should be all or nothing. I do agree that we need to firm up the backup remote plan. If we need to have it, I think it needs to be more firmed up. And by my count, I heard 9 people speak for masks, 5 against it. And there were a lot of people online who didn't have to comment, but I appreciate all the all the comments either way.
Is that it? Holly?
So I, like I said, reiterate what Tim and Julie has said, and we appreciate everybody's input, and you guys put a lot of work into the information you look up, like we're doing our due diligence and everything too. So we appreciate everyone coming out and speaking. And I would like to just a couple of comments about, maybe I would like to address just 1 or 2 of the comments. So just so people know, because I know the minute really stinks and you get talking and then you get cut off. But most of the people who spoke tonight in this room, at least, we have received detailed emails from some of it. You even reiterated some of the things that were in your email. So we do have a lot of information that you sent us, a lot of your comments. So I know you get cut off after a minute, but we've read what you sent us, which is a lot of what you started to say. So we did hear that. So just, I want everybody to know, people didn't necessarily get totally cut off. We did hear, their full comments and emails. And one thing I do want to say is, as far as to Sarah's point about speech and language, and they have to see, we do have window masks. My husband's a teacher. We do. Well, my husband's a teacher. He used it with some students who were hearing impaired, and it worked well. So, well, I don't know. Maybe we have a different brand. We should check it out because he didn't have that problem. But I just wanted to be helpful and throw that out. He worked well with his student. Teresa mentioned about maybe if we don't have masks, we could distance 3 feet. If you look in the toolkit from the state, if you have masks, they recommend 3 feet, 6 feet or more without masks, and then certain activities like gym, and like I said, singing and instrument playing should be a little further, and they recommend masks for that definitely. So 3 feet with no mask is like not in the guidance at all. That's, yeah. And as far as if we do say agree with the plan and start with masks, well, as Sean brought up, it's also in the toolkit from the state, which I understand the toolkit from the state came out a week ago today. So it was after the plan was starting to be formulated. They have, like SAU 29 is using, and I believe Monadnock actually adopted a stricter version for their staff and students than the state version. But they have a mask metric of, when you can, back off on masks and when you should, have it. So that might be helpful if we try to incorporate that. I think the only other thing I just want to address is when people are saying that children aren't really affected, and that might have been more true last time, but now and even not last year, we had kids in our district. We had spread in one room. We had kids in the district who got sick outside. And one of the things Education Secretary Cardona said is that, like the goal is to keep kids in school. And what happens in the community affects what happens in the school. Most of the time, because of the mitigation efforts, things didn't spread in the school out to the community. But we saw that at one point last year, we had, approximately 50 staff and students quarantining at one time because of get-togethers outside of school, where in both buildings where people were, getting together, partying, and it just, bam, we had like 50 people out. So that's what we were saying is, we have to look at the whole broad community and the students and the staff and everything. So it is like a bigger thing we need to look at. And just this weekend, according to the, the state figures, there was 586 new cases from Friday to Sunday. Of those, 96 were under the age of 18. So 16% of the new cases this weekend were students who were under 18. Now, some of them, I don't know how many were under 12 and couldn't be vaccinated. So that's, like we were saying, that's only going to increase. It's been doubling. The percentage has been doubling. The percentage rate has been doubling. Positivity rate has been doubling. So 98 students, most of them probably are not hospitalized. They don't give you hospitalization rates. But like Lindsay said, if one of those students was one of our students and passed away because we did not require masks, that's basically on the 4 of us and the parents who decided to send their kids to school without masks, who passed it along. So those are the bigger things that we have to look at. So clearly, and you guys know me from last year in our reopening discussion, I tended to be on the more conservative side. So clearly, I'm in favor of masks. I'm in favor of going by the data-driven approach that the state put out for when to wear them and when to back off. I would like. And here's the sticky part. So we are all really expressed, and a lot of people, the remote plan piece of this as one of the big things. So what do we, and maybe there's a question for later, but I don't know how we go about proving it. But as the plan is right now, I'm in support of most of it, but I'd like to see more detail. So I think that's all.
It's all yours for now. All right. I think I took a little bit of a different approach from you guys because I kind of went by bullet point to bullet point on the plan. So this might take a minute or two. So one of the things that's difficult for me this year is that this is the second year that we have to make these decisions. So I was monitoring the community connections emails and compiling stuff along with Mrs. Diorio. And so basically, as I was seeing communications coming in, it was a more of a 50-50 split. I get, 2, anti-mask and then, 2 pro-mask. So it's split down the middle, which basically means that whatever decision that we come to tonight, like whichever it is, half the people are going to be satisfied and half the people are going to be extremely mad. I've had people telling me that if we vote for masks, they're going to pull their kids out of school. I've had people say that if we vote to make masks optional, they will pull their kids out of school. So again, whatever decision that we're going to make, we're probably going to lose some students, at least temporarily. And again, it was really close to a 50-50 split. The one problem that I had as I was reading a lot of I just couldn't escape from as I was reading a lot of these correspondences was it should be parents' choice. And it seems so reasonable that, of course, parents should be able to choose for their kids. The problem that I couldn't get past is that they're not just choosing for their kids, they're choosing for every single person their kids come in contact with. They're choosing for the other students, they're choosing for staff. And so that's basically taking choice away from those groups. I'm looking at a lot of different things. My own personal opinion is really at conflicts with my responsibility as a board member. But I have to look at several of you were saying, I have to look at kind of the broader picture and all of the available information. I read every single thing that was sent to us. I did, and even did my own research to verify some facts and all of that. I also, was in contact with the district attorney, and I sent you guys the email as far as, his opinion on that. So that's an important factor. As I look through the plan that would receive a yes from me includes the following things. It would include academic supports that address learning gaps, but that can be tailored to the needs of individual students. The gaps are different for each student, and I don't think a one-size-fits-all approach would work. Or at least be as effective as it needs to be. I want to see a specific plan for athletics with COVID precautions in place that is received and approved by the board. I don't want to just go, it goes with field trips too. I don't want to go with just this, blank check and say, okay, we, don't have any say in any of that. The district policies as usual bothered me a lot as far as that. Now, once that approval is granted, same as last year, scheduling practices and games, would be at the prerogative of the administration. I don't think the board should be involved in the actual scheduling, but to know what, the precautions going to be taken on both of these things, I think is, the board should know. The board sets policy for the district. That is one of our main functions. We appreciate the administration. We appreciate all the amount of work that they put in, but it is the board that sets policy. And I think that we shouldn't lose sight of that. I think that when we talk about counseling, I think we need to have counseling services, not just for the students, but I think we need to continue it for the staff. We're still dealing with a lot of, very out of the norm circumstances. And I want to make sure that staff is included in those counseling services. Where we talk about, whole child wellness, we need to think about, the staff as well, as far as, complete wellness. I'd like to, we talked about the curriculum. I want to see curriculum that's, driven by student need and geared towards student achievement. Again, learning gaps are going to vary from student to student. I think it's hard to say, let's address all of our low test scores when we just had a year of, everyone put in so much effort, and I know this is going to sound lousy, but for a lot of students, it was a wasted year. And those gaps for some students are extremely huge. So I want to see a curriculum that really addresses that and really looks at the individual students. I'm fine with ELOs and community service to continue because those business partners will decide what they're comfortable with. And we can work with them. I mean, they're gonna tell us, hey, I don't want this in our business. And then we put on pause, you know, they would have the say on that. I do think that all the instruction needs to be done on site and in person. I don't know if we have to provide a remote option for specific medical needs or anything like that, do we?
Not necessarily remote, but we have to provide a learning, support for learning at home.
Okay.
If they file for an accommodation based on medical.
Okay, so, you know, if we have to do that, that's great, but I'm so hesitant if I was a remote option otherwise, because it just didn't do well for so many of our students. I know there was some issue around IEPs and 504s, and I think that it was tough, you know, getting everything that we needed to get done for those students done. But I just think that we need to keep that in mind, that those students who are in particular need, we just need to make sure they're getting everything that they need. Yeah, the social emotional support should be, I know we have in the ESSER funds, we have social emotional supports all over the place. I think that's great. And we need to use them. And again, I think those things need to be tailored to individual students' needs, because, you know, we've heard that some students are having really big problems with this whole pandemic thing, while other students are taking it more in stride. And that's not to say that one student is better than another. We all handle things differently, including every single person in this room. So I think that those social emotional supports really need to be, you know, tailored, you know, to the individual students, and we need to pay attention to, you know, what those individual students may be struggling with the most. I'm totally for all the windows open, the ventilation, outdoor spaces. I would love to be able to use the outdoor spaces as much as possible. If we're, you know, I think Teresa mentioned, if we're able to do outdoor spaces without masks, I'm all for that. I am in favor of masks going into school. And again, this is where my own personal stuff is coming in conflict with my board responsibilities. But I do think that given community transmission right now, that we do need to at least start with them. I think that I don't know, I wish Mr. Boggio was here. I don't know how mask breaks were handled at the elementary school last year. I heard several different things about the mask breaks. Mask breaks need to happen, and some students may need them more than others. And again, we need to pay attention. We can't just do a one size fits all. We need to pay attention to those students who may have harder times with them than others. I think that if we need additional mask breaks, we should take them. Again, optional for outdoor, hopefully optional for like outdoor settings or recess. I really want to see the administration monitor the community transmission levels. I want to know how often, you know, is it going to be daily? Is it going to be weekly? I don't think it should be any less frequent than weekly. And as soon as that optional model is available, you know, once we reach, you know, low levels of community transmission, I really would want to switch to optional. I also think I also want to say that it's in the case of like OT or PT, if a student is, you know, one-on-one, you know, with the therapist, and that therapist is vaccinated and comfortable, and that student just can't express themselves, is just not getting the OT or the PT that they need, you know, is there an option, you know, for that student, you know, with this teacher to not have the mask so they can receive their services, you know, because that is a problem. You know, the self-expression is a problem. The social cues is a problem that is all hidden with a mask. So can that happen on a one-on-one basis? You know, maybe it can, maybe it can't. I don't know, but that is a question that I have and something that I would want to see addressed. I've mentioned before that several parents, you know, mentioned on either side, mentioned, you know, taking the children out of school. If that happens, that is their option. You know, I mentioned parent choice, and last year when we had our reopening plan, I didn't agree with it. I was one of 2 dissenting votes. I supported the district. That's my responsibility, you know, as a board member, even though, you know, I was in the minority. But I did keep my kid out of school, and that was my choice. And I make no apologies for that at all. I did what I felt best for my kid. If parents do feel the need to do that, I think that the school needs to provide, or the school district needs to provide information to those parents as far as what resources they can still get from the school. I think that they need information as far as where they can, go online to sign up for classes, should they choose to pull them out. I think they need information on the differences between remote learning and true homeschooling. But I think that it needs to be very clear that, whether it's a remote situation or a homeschool situation, their responsibilities that the school still has to these students. And I want that information out there so parents can make the best choice that they can. I don't think that information should be, kept secret at all or made difficult to find. I think that we need to put that, completely forward and out there so that people know what their options are. I did not have a problem with any of the sanitation or hygiene protocols. I think that we did a really good job with that last year, and I would want to see that continue. I don't have a problem with the playground being opened. I would want to make sure that we did try to keep that physical distance though. I think that outdoor time is going to be extremely important, all right, for the kids. I think I mentioned the stay-at-home guidance, and we kind of talked about that already as far as when a COVID test would be required. So we kind of answered that, and that's fine. But I think that needs to absolutely be added in, needs to be absolutely clear. Everyone needs to know, and it needs to be sent out to everybody in whatever platforms that we have available. And we don't really have a say over the mask when we're riding the bus. So that is what it is. And that's all I had. So questions? Holly?
It's not really a question. Something you said sparked something that I forgot to say.
Sure.
Okay, so mask wearing, I would like to really stress. I stressed this a lot last year. I know I got some grief because of it, because we brought it up too much, whatever, but please make sure that the adults have the mask over their nose, the kids do. Every teacher abides by it, and not this teacher over here but then this one over here has a hard time because they're enforcing the rules and this one isn't. Huge problem in the middle high school last year. Not so much in the elementary school as everybody says, because those kids, are more, but just please, if you're gonna wear a mask, wear it over your nose. What's the point if you're not? So, and that was a big problem. So that's one thing I know last year. I was in the building a few times and I saw it. So, and yeah, that was the one thing when I heard forgotten to say. And there was one, SEL was the other thing. In the call with US, the education secretary, that was a huge stress, that SEL. Don't skimp on SEL. Just saying, every morning we're going to do a little check-in. How are you feeling? How the ones that are color coded. Are you feeling this today or that day? That's not good enough. They really stress that use the ESSER funds to do in-depth, meaningful SEL. Because he even said at one point that's almost more important than all of the other stuff, because you know what I mean, that the kids you got to get that in order so that everybody can function. So those are my two things that you sparked me.
Okay.
So thank you.
Jim, anything else?
I just had a question in regards to your points when you're talking about students being possibly removed from school. Last year we had that opt-in, opt-out per quarter. Are you envisioning the same thing, a quarterly thing, or
because
one decision for the year?
No, because we still need to have, teachers still need to know what to expect in the classroom, and the in and out is, too disruptive. So, should that be the case, I would want to see, my personal choice would be to see it go quarter by quarter. Because it needs to be fair to the teachers, or semesters, however you want to word it.
Okay, thank you. I just needed clarification.
Julie?
My question on that is if we're not offering a remote option and a parent takes their child out of school, we're not in charge of their education during that quarter. We have no say. We don't know what the curriculum is. I'm not sure it's fair to expect the staff to bring a student who's been out of school for a quarter or a half a year, not following our curriculum, to then try to manage what they have or have not learned, where they are, and bring them in here. I think that is asking a lot of our staff because they're not following our remote plan that's provided by the district. If they're homeschooling, I think it'd be more of a challenge to let them come back into the district.
And I would just respond to that as we do that all the time. If someone moves and comes from another district, we don't know what that district has taught. We don't know what the other state has taught. We don't know what that is. So we deal with that all the time. And again, getting the information to parents so they really know what those options are. And even giving them some guidance if they want it, hey, look at these particular courses. But we would deal with that if someone moved in from out of district. And I think our staff can do that. And there may be some staff right now going, God, why is he saying that? We can't do that. But I have confidence in our staff.
I guess it's a matter of numbers. We have 1 or 2 kids that come in.
Right.
If
If it's 50 kids, that's
not
going to be tough.
Right.
That's going to be tough. But for me, that's where parent choice comes in.
Absolutely. They have a parent,
Right.
they have a choice to
And Holly?
So I agree with Julia, but that's my question with that is, and this would be Wayne or, any of the other admins who deal with this, or Angie Oil probably knows too, because of the paperwork involved. When we have a student gets pulled out and the parent legitimately homeschooled, like there's a whole process.
There's a
there.
difference. Yep, there's a
Yeah.
difference between a
So-
remote learner and homeschool. Yep.
But they won't be remote learners unless they have a medical reason. Like we won't have just because the state's not mandating that.
When a person talks to me or to Kathy Bean or to Kathy Johnson about homeschooling, I have a whole packet that I send out to them. It's about this thick, and it has all kinds of different options for them to groups that they can use, different curriculums they can use.
Great.
So they have all of that information when they inquire about homeschool.
Perfect. Thank
Which
you.
is different, and that's the way it's
Yep.
always been
Yep.
done.
Yep.
And Kathy Johnson even has those in her office, the packets.
Great. Okay.
So I think it's important to clarify that when we say a remote learning plan, as part of this plan here, that we need, and what I thought we mean, and maybe I'm wrong if I'm saying, but is if the state says, bam, you have to go remote, or if, we have cases that hit a trigger, if we're even allowed to do a remote trigger anymore, and say like this classroom needs to go remote for 2 days, not a parent decides their kid can be remote, because with that's not offered anymore, unless it's a medical support thing, which would be different than a medical accommodation support, which is different than a remote zooming in thing. So I think it's important just to make that homes, if you pull it out because you don't want them to wear masks, or you do want them to wear masks and we aren't wearing masks, whatever way it goes, then that's homeschooling with this packet for Ann, and I'm sure there's a process, like, you can't homeschool for a week, send them in for a week, pull them out for a week, there's like a whole.
Well, that's what I'm saying.
Yeah.
But even with homeschooling, there are still things that they can still.
Oh, they can do sports, they can do
all
music,
kinds
they
of
can
stuff,
do all kinds of
after school
stuff.
and still use school
Oh,
resources. And I
absolutely.
think that.
We have
Yep.
homeschool parents that do
Yep.
that.
Absolutely.
Yep.
But I just want to say, because when we say about the parents can choose a remote option, they can't choose a remote option unless they file a medical accommodation, and that's support for a medical accommodation, not a remote option. I just want to make sure that's clear.
That's fine. I think I said straight on here that I'm not looking to do a remote plan for the school.
No, exactly, but somebody, at one point, it got mentioned that parents choose a remote option. I just want to make sure people listening and the minutes and the recording, just so it's,
I think the remote plan is, we're asking for if it becomes necessary.
Correct,
Yeah.
correct. That
As simply as a
Not on a
fail
child.
safe,
that last ditch emergency.
as a fail safe.
And for the whole school and the district, not a child by child. Right, okay, yeah. Just want to make sure that was as clear as possible.
Yep. Anybody? The only other thing that I'm going to add is the legal advice from our attorney, because I did ask him about all this stuff along with many, many other things. Blah, 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 blah. All right, right now, the CDC is recommending masks in indoor spaces, even for those who are vaccinated when transmission is substantial or high. Further, CDC is recommending universal mask wearing for all teachers, staff, and students, regardless of vaccinated status. With that said, I think this is a fluid situation, and as we creep closer to herd immunity, the recommendations may change. Accordingly, the option of no masks for the vaccinated does not appear to be, because I was asking him about vaccinated versus unvaccinated and masks. Accordingly, the option of no masks for the vaccinated does not appear to be currently recommended by the CDC. While I wish that was the current recommendation, it simply isn't right now. The board needs to be careful because it could possibly lose discretionary function immunity if it adopts a policy that is contrary to prevailing medical. Anybody, anything? So here's the thing, it's like, we can call a vote, right? But what are we voting on?
Exactly. Can I offer something?
Yep.
I think what needs to be added to this plan is what Elise said about following CDC, yeah, that, sorry, the acronyms, it's late at night, been here for a long time. Needs to be added in here, that all these those guidelines will be followed per State Department of Health and Human Services.
And that's fine, but here's the thing. You can say that, right? And then they're gonna go and have paper overload. They're gonna have, I mean, some of the stuff I think needs to be summarized and pulled out in specific.
Well, that's what I'm saying. I'm not saying put the whole thing in, Sean. I'm just saying the school board policy will be to follow DHHS guidelines when, put it under the stay-at-home spot, and put it under any other spot that you think it needs to be.
Some of it needs to be in black and white.
I agree. I think
Based on the
specifics need to be
communications
pulled out.
that we as a board sent out last year,
Okay.
I think the community, and I hope, found it helpful. That was very black and white. If this happens, do this. If you need, if you have to quarantine it 3 days, if it's an elementary school, can be by classroom. If it's one school, has to be shut down. I mean, I think it needs to be very, very clear so that there's no misunderstanding. So that parents and families understand what the policy is. This is so vague. I'm not comfortable approving this as a reopening plan because it doesn't say anything. I mean, it says a lot.
When do you want to schedule your next meeting?
Well, unfortunately, I'm kind of upset we're getting this 10 days before school starts. This should have been something that we had much more time to digest. We were presented with it earlier. Now we've got kids back in school in 10 days. And we're being asked to make a decision or to vote on something that doesn't seem at all complete to me. So I am uncomfortable with that and a little disappointed that we are having this major of a conversation 10 days before school starts, and there's a lot of missing information.
So one option would be to accept it as a draft. And you got a health and wellness committee. I think Jim and Julie are on that committee. They could review it, get it.
So now you want facilities
I don't
and
think-
personnel and health and wellness. and you
Right.
handle
Yeah, I
all
don't think
these
health and
things in
wellness
10
has
days.
any meetings scheduled.
Yeah, no, the whole board has to review it.
Yep.
I don't know, that's my personal opinion.
I agree.
I'm one of
I-
four, so.
If it, without specifics, if it came to a vote right now, my vote would be a no, just because there is just not enough information. So what does the board want to do?
I mean, we'll have to schedule another meeting just to, when they add stuff, the things we talked about, and maybe send it out to us ahead of time so we're prepared, and then schedule another meeting. I mean, right?
Well, I understand the packets have been waiting for this plan to be inserted this, so the
Right.
packets haven't even gone out to
Well,
the
the packets
manager.
will go out tomorrow or Friday regardless of this, because we have to get the.
Right,
packets out.
right.
We were hoping that we would be able to put this in.
I'm not disagreeing with any of the premises in the plan. I really am not. I just think it's a not detailed orientation. It leaves too much room for interpretation. And when you're creating a plan that is gonna go community and district wide, I think if you present a plan that has so much room for interpretation and people interpret it differently, we're asking for all kinds of problems.
I agree 110%.
Even when we had a detailed plan last year,
There was still
there
confusion.
was a lot of misunderstanding, a
Yep.
lot of, some follow it, some don't, some have argued, so. So we should schedule a meeting.
Mhm.
I got my phone.
Okay.
I mean, if you want to try and schedule, like, when people, we have a HEF meeting on Monday, and there's two of us already there, and Ann and Joe is part of HEF.
If he's there, I'm not sure.
Oh, no, he's not part of.
I don't know.
Sorry.
I'm not sure.
Oh, Ann said no.
Well, he'll be back, but he's only part of our meeting. He's not part of the.
Oh,
Yeah, he's
he's good about coming, okay,
he's in
sorry.
relation to the
To
art
whatever,
project.
oh.
Yeah.
Pardon me, sorry, he's been there. But nevertheless, people can come, you know, I mean, we can pull everyone together.
Unless it's Thursday.
There's
or
also
Friday,
a
I'll have to-
facility meeting on Friday at 2:15.
But can we expect it to be updated, you know, everybody, you know what I mean, in time, like this already Wednesday night? I'm just saying.
So I'd have to speak, I mean, I'm here Friday and I don't know if, obviously Joe's not here, so it'd have to be Jan, Elise.
I don't
Ann.
think Jan can come. Her husband is not well.
Yeah, she's got an emergency. Yeah.
So I think if Elise was on board, I think we could identify the details that you're looking for and maybe get a digital draft out to you and.
What time's the meeting, because I work.
So, all right, here's something else to consider. And I know I'm gonna regret saying this the second I say it. So tomorrow, Friday, can you talk about Friday, right? Friday, you have facilities. We have personnel.
Personnel, yeah.
I have to drive to Portsmouth right after personnel, so that's gonna really not be good. I think that there should be some form of board input on this.
Absolutely.
I am free all morning.
All morning Friday.
Yep,
I
and,
mean,
and can be here.
I mean, I work.
No, I understand
Yeah, I
that.
don't know if I am, I could maybe zoom in from my office and take my lunch break at night, 9 o'clock or whatever, if that's the thing.
I mean, I'm not talking for me, I'm talking about putting together,
Okay, sorry.
putting, because that's what you're saying, right? Can they put everything together
By
in time
Friday.
for something?
Yeah,
You know, and like I said, am I gonna sit here till 9 o'clock at night and drive to Portsmouth? No, I am not.
oh, no.
I'm not gonna do that.
On
So,
a Friday night? No.
nope. But like I said, if it helps, and it probably may not, I am available Friday morning
For a meeting.
for whatever.
Well,
For-
I mean, I can, like, I could try to zoom in if it's on during the workday. I can zoom in from work.
Unfortunately, I already have 2 committee meetings that day, so I've already
I know,
lost
I'm in-
most of
I'm in-
my
I'm in
afternoon.
one of them, right.
Right, and I'm a gym, so I've already lost a big chunk of my afternoon for 2 committee meetings back to back on Friday. So it'd be difficult, I can't commit to any additional time on Friday. I don't work.
No problem.
That next week.
I'm good next week, except for the EGF.
Or we could change that, again.
Yeah.
Just one idea would be to push personnel down as the immediacy of personnel probably doesn't exceed the immediacy of this.
Well,
Personnel
Does it though? Because there's lots of personnel stuff, and the personnel stuff needs to happen too. I mean, there's, we have
negotiations.
months of stuff that need to happen in the next couple hours. You know what I mean? Well, if you guys want to get together next week, throw dates at me.
I'm, full disclosure, unless it is Thursday night, I will be remote. I'm in Connecticut Monday till Thursday night.
I could do any night, given it, but.
I don't mind being remote.
Got a
just
lot.
We have Parks and Rec on
Yeah.
I don't mind being remote, I'm just letting you know.
No, and you can be remote. We just have to have a quorum of the board present now. So if you're remote, that means everyone else has to be here. So as long as everyone
I
understands
can do
that.
it, I mean, you want to do it Tuesday night? Is that
I was
late?
just gonna say Tuesday's not great for me, but I could not go to the meeting I have planned on Tuesday.
Do you want to do Tuesday?
I'm good with Tuesday.
Will you do Tuesday remote?
I sure will.
All right, time.
Six.
You can be here because usually we do 6:15 for you. but-
Yeah, but it's a little different now.
So 6 is work. 6 is okay. All right, then we'll do Tuesday at 6.
Is there enough time to notice the public? That's in public, right?
Oh, yeah, there'll be plenty of time to notice, yep. All right, is there anything else we're gonna do with this right now?
May I ask a question?
Of course.
So in our oversimplistic view, we thought this was great. Is this format okay, but with more detail, and could you provide us with your feedback in writing? Because I think we can work on this.
I'm happy, if it helps, I'm happy to give you a copy of what I
That
wrote
would
down.
be wonderful.
That way, and you email
Yes.
that to Sean,
Yeah.
and then I can email it to the
Okay.
A team, and we can probably set up the meeting for Friday.
And I would say the perfect example of this is that we know in our heads what we're thinking. This is like looking at student work for you, because we knew what we were saying. And clearly, we didn't communicate very effectively.
Do we think it's pertinent to have that list named the petition vetted by this? Is that?
All this has is names on it.
Yep.
Does not have addresses, it does not have anything.
And some of them signed the online petition too, so
Right.
there's duplicates.
So we'll just put it in.
And some of these people on here are over 18. I mean, so
Yeah.
I just.
So
wanna
we'll-
make sure-
so we can put it in the record and
Yeah.
to have it. We can acknowledge.
So I wrote down all the stuff Sean, all everybody said, so if I had a few things, it's okay by email and.
I think if you
have
guys have,
types too-
if you guys have stuff, you should email in as soon as possible.
Yeah, like tomorrow.
Yeah,
Yeah, I can do
like,
it tomorrow.
yes.
Not tonight, but I. can
No,
do it
tomorrow.
Yeah.
All right, so then that discussion is gonna be continued.
Questions. Important questions.
Yep.
I just want to take some, I don't want you to feel bad, but I think it's a good framework, and I think you have, like, how you were like, oh, we thought this was good. I think, we appreciate everything you guys have done, but, just looking at what we're gonna get slammed with.
No, absolutely. It makes perfect sense. It makes perfect sense.
All right, we good? All right, so then we have Sam, you're the last one, discussion with athletic director. Hey, buddy.
Hi. So sorry you don't have anything in writing. NHIA hasn't really given us much guidance to what to do. What I would do is we would wear the masks on the bus and not wear masks at competitions. NHIA did go back to the regular schedule, so we play all Division IV schedule. Unfortunately, the regional schedule is not an option with them going back to the regular schedules. As always, the ADs communicate if there's an issue, let's say Newmarket, I'll know about it right away. So there's that. I think that, again, the numbers this year are much higher than last year, participation wise. I had 96 kids come in 2 days to sign up. That's middle school and high school. So I think kids want to play, kids want to, run around and do the normal things again.
When does your season start? When does stuff start?
Our first game next Saturday, next Thursday.
They're already out there. I go there, so.
Was there a restriction last year about the bags, like the gym bags and all that? Is
We
that?
did put them, so I did leave the bleachers instead of the spectator bleachers being on the fan side, I did leave them on the player side so that we can social distance when the kids are not participating. The bags go against the fence on the far side, and we spread them out as far as we can.
All right, so you're looking for us to say, yes, go ahead, or something else, right? But preferably, yes, go ahead.
That would be ideal.
All right.
For what you
Well,
did
this is,
last- that's the
this
thing,
is,
we have
I mean,
nothing
this
to
is the thing,
approve.
I've got,
Yeah. We have nothing to approve.
Have something in writing by Tuesday.
That's
Will that
what
work?
that's what I was gonna say, yeah.
And we'll,
Can you?
that'll be the second item on the agenda.
So does that mean we don't practice till Tuesday?
You're practicing now, I thought. I saw people out there.
Yeah,
so,
yeah.
Yeah,
So-
so I guess that's a moot point.
Yeah.
Well, so, so here's the thing, right? I'd like to have something in writing, but practices we've kind of left up to the administration before anyway. At least as far as the scheduling of practice.
I think some optics of approving the athletics without approving the mask
Is bad.
might be bad.
I don't think it's a might. I think it is. But I'm saying that in the interim, just for practices and not games.
Well,
I don't know.
we all supported the part of the plan that calls for no masks outside.
Right.
We were all very vocal about not having to wear masks outside, so if practice is outside, I don't understand why there would be an issue with that.
So I was
That's kind of where I was going.
Well, I had mentioned, and it was in with all my other stuff too, about that, in the state guidance, they do say that, like I said, for some high risk activities, it does say, masks they're not recommending masks in outdoor settings, but they can be considered for high risk activities such as close contact sports outside. But I know, I'm not new here. I know that's not gonna fly. So, but I agree with Jim that, when you said that, when Sean, when you said that practice was what the administration could do that. Last fall, when COVID, I shouldn't say numbers were high because they weren't, but when we didn't know what we were dealing with, all that was part of the real
Yes.
sports plan.
Yep.
In the spring, when we said all this, administration could schedule practices and it was specifically said numbers are down, we're looking good, which is and it's outside, which is a very different situation now. So, I mean, like I said, mass outside, I know that doesn't fly in this district, for sports. So I'm not even gonna go there. It's in the state guidance that it's mentioned, but that's as far as I'll leave it for the record. But I agree with Jim that if we say their plan is too vague, and then we have no plan for sports, that just makes us look disingenuous. And we can't approve anything tonight if we don't have anything to approve. So, yeah.
So
And they're practicing anyway, so.
Well, so what are we saying for practices? I mean, that's kind of what I'm coming down to, because I mean, for games and such, we can put something together and we can look at it on Tuesday and be in time for the game. But, practices. What are we doing for practice? Because we're already doing
Yeah,
practices.
in my opinion, it's a moot point. It's a fait accompli. They're doing it.
Yep.
If you want to get all
I agree with
fancy,
Holly.
what are we gonna do? They're doing it.
Right.
So,
If we just could let them continue to practice and have a plan on Tuesday.
Yeah.
I will be zoomed in on Tuesday. So I'll have to join via Zoom.
Okay. That works.
You get me the plan by Monday.
I'll get it to you tomorrow by noon.
Okay, thank you. Thank you, Steve.
All right. Yeah, lovely night. So, all right, any other business to be conducted by the board? We got to talk about, we have to talk about Kayla.
oh, yeah.
Committee assignment.
We need to do committee reassignments. I think what we should first do is, because obviously whoever comes in, they're going to have some committees. So I think that we need to wait on committee assignments, with the one exception that I'm going to ask you guys to consider is clearly Community Connections is going to be gearing up again. Holly's always been the backup for Community Connections, and I'm going to need help, and I'm going to need someone who's available during the day. I would like you guys to agree to have Holly join me on Community Connections, because I am not going to be able to do what we need to do all by myself.
Yeah, Facebook page.
Yep.
Yeah.
Yep. Are you okay with that? Jim?
Am I okay?
Yeah.
Yeah.
All right, so you're willing to help me out on that? All right, so we can switch, you can take Kayla off community connections, put Holly on. I think that the other committees are gonna have to wait until we get the next person on.
Agreed. I don't think we can divvy up hers between, I mean, I personally am feeling already like
I'm feeling like, are you kidding me?
Yeah.
Her name comes off them all, though, right?
They're gonna have to, yeah, and
And
then,
officially it comes off,
Yeah,
even
they
if
get-
nobody else goes on.
correct, they're gonna have to. So what we should do, I think what I've done on other boards is we've sent out basically a solicitation for letters of intent. We've asked the community for letters of intent and, who would want to fill Kayla's seat until the March elections. So I think that that's something that we need to do. And then, and I've done different things on different boards. The board can then either look at the letters of intent as a board and choose someone who we then appoint, or we can choose, narrow it down to several people, have interviews, then decide, then appoint. So those are two options that we can do. What do you guys want to do?
And you've done it both ways?
I've done it both, I have done it both ways. Yep,
Can I ask Gwen's opinion? 'Cause
sure,
she's been around
absolutely.
this forever.
So, I mean, there's a couple of ways to do it, but I think your letter of intent, go through your justification. What do you need in a board member? And then based on their letters, you decide who might fill the spot. Some boards interview, that's really a valuable scenario. Depends on how many letters you get.
So my leaning, for whatever it's worth, is that, like I was saying, we have a ton of stuff to do in no time at all. I would like to get letters of intent, have the board look at them, and then appoint, as opposed to throwing the interview step in there.
And that's done in public, we talk about it in public session, right?
But we're talking about people, so is it
I would think
public?
no.
You said it's
You
board
would do
members,
this in
right?
public session, just like the elections are done.
Yeah.
All right.
And what I've done in the past is just put a notice in the newspapers that the Hinsdale School Board is looking for a member, for someone in the community to fill a spot until the March election. And this would be till the March election, and it would only be a 2-year position because
Kayla only
it
has
would be
2.5 years.
fulfilling
Yep.
Kayla's
term. Yep.
term.
Yep. All right.
And the letters would be sent to me as clerk, school district clerk.
When you craft that, can you send it to me so I can put it on Community Connections
I was gonna
Facebook?
say you put that there too.
Yes.
Yeah.
All right. Is everybody good with that?
Sean, when
Yes.
you do that one, can you make it shareable though, so people can share it? Because there's only about 200 people on the community.
I
Connections
understand. The
page.
problem is to make it shareable, you have to open up the comments.
Right, I was gonna say,
And we're not gonna do that.
All right.
Can we just post it on Village Voice and some of the other ones too, maybe?
Yeah, well, and I.
And we can post it on our own pages, our own
Right.
individual
I
pages.
can post it on, we can post on, get it posted on the Village Voice and then they can share it
Yes.
also.
Yeah,
Yep.
yeah.
Is everybody all right with that?
Yeah.
Okay. What time frame do we want to take letters through?
Our meeting's coming up.
Yeah, but we need more than 2 days.
No, our September meeting, I said.
All right.
September.
Oh, I said Tuesday.
So, yeah, Dylan said Tuesday. 2 weeks? 2-week period?
What is that?
That's September 1st. Or so why don't we make it September 3rd?
Okay. Is everybody good with
No,
that?
That's Friday.
Yeah.
Yeah.
All right, September 3rd. It is.
And I'll make it September 3rd by noon and that way I'll get the packets out after that.
Okay.
Does that sound good?
Yep, that sounds fine. Does anyone else have anything for other
So
business?
that's Friday at noon. It's
And there's a
Labor Day
holiday.
weekend and the meeting's on Wednesday.
I will deliver your packets.
I do have something else.
Yes.
I was just gonna say, we're not even, we don't.
I'll
packets
deliver
are
your
gonna-
packets.
Jim?
All right, so, dog licenses, I emailed Wayne and Joe and today. I did speak with Julie several times and, we've got the colors, we've got the options for the metals, with you guys. So, I think it's the 5th grade that does it, right? Fourth grade, I'm sorry, fourth grade. Fourth grade, do it again this year. And in the first email I sent, I had said by the first Friday in October, Julie needs them, but that's wrong. It's October 8th is when she needs our decision. So that's, I think, right before our board meeting. So if I could have it by the 8th, and then if Joe wants to discuss it at the meeting, we can do that. So that's the scoop with the license vote.
Okay. Oh, what do we want to do for officer elections? Because there's right now no vice chair.
It'll have to be after we get a new person.
After the new person?
Yeah,
All
after
right.
you can do all that, but the.
All right. I mean, that just means that I can't
Oh, wait.
get
no.
sick or anything. I mean,
Wouldn't it go by seniority?
Yeah, I mean, if that's the case, I don't both jobs. So
Right.
if the board's okay with that, if you drop dead or get sick, not drop dead, sorry, if you get sick.
Thank
if
you.
If you win the megabucks.
when I win the
There you
megabucks,
go,
it don't show up again.
Yeah. I like that picture.
Okay.
But we wouldn't do it at the September, because if that's where we're gonna vote, the new person wouldn't. So whoever we decide, we're gonna decide that September.
Oh, they wouldn't necessarily be there. Yeah. So-
You could appoint tonight a interim chair.
Vice chair.
Okay, vice chair.
Okay.
And then, do the elections.
In October.
I just want to make sure our bases are covered. Like, I'm not planning on going anywhere.
I understand, Sean, but that's what you
Yeah,
can
I'm going
do,
to
and then
Portsmouth.
plan and reflect in the minutes that you'll be doing committee assignments and
Okay.
officers in October.
All right, then I need someone to motion for an interim vice chair.
I nominate Holly.
Okay, is there a second?
Oh, no, I don't know if you do that second.
No, I can do it. If you didn't, I can do it. But I'm gonna give you the opportunity. All right, so motion and a second to for Holly to be the interim vice chair. Discussion? All those in favor say aye.
Aye.
Opposed? All right, I feel better now. All right, is there anything else under other business? Nothing? All right, let's get through these reports. Financial report.
Thank you for a wonderful 17 years. You've had a long meeting.
Has it been that long, Tom? So 17 years tonight, like tonight was 17 years, because that's how it feels.
It's pretty close, yes.
Yeah.
Yes.
Been a long meeting, so I won't go on with that. And basically, we covered all the financial stuff.
Questions for Tom?
What was it? I'm sorry.
No, go ahead.
I was just gonna ask, the final.
Funds, the final funds
Was
balance.
that 529? That's the final number?
Yeah, that's what I was gonna ask too.
It's in my cover page and it's on the report and it's 466, 695, 30.
466, 695.
All right. Thank you.
Okey dokey. Any other questions for Tom? Holly?
I don't have a question, but I do want to say as budget committee rep several times over the year and chair for 9 years. I've worked with Tom very closely and I'm really so thankful for everything you have done for us, Tom. And I'm gonna miss you, and I told you I would cry, but I'm not gonna cry.
I might cry.
So I'm gonna
Don't make
probably
me
cry
cry.
later, but I will. I thank you so, I think it was great. Being chair with you, business admin it was good. Thank you.
If I may, I'm going to echo those sentiments. I know, Tom, that especially in the beginning that we butted heads a little bit, but I have actually really grown to appreciate your insight. I actually could get watery. What the hell's going on?
So you are kind of.
Yeah, I am kind of terrified because no, I actually,
Are you allergic to hair?
I am. No, just a very heartfelt thank you.
Thank you very much.
All right. Letting Tom off easy, huh, for his last day or his last time with us.
His last day.
I know,
You've
he
been letting
wishes.
me off
He
easy for
wishes.
months. I don't know what's going on with you guys.
It's all the love, Tom. All right, curriculum
Mutual.
report.
Well, I'd like to start by thanking the board for giving me this opportunity. It's both exciting, a lot exciting and a little terrifying, but it'll be okay. So thank you for this opportunity, and you have my report if you have any questions, albeit short, because I was only 5. I wrote this.
Yeah.
So if you have any questions, I'd be happy to answer them.
Questions for Karen? You good? Paula, you good? Julie, you good?
Gosh, I can find it. Yeah, I'm good. I did look at it when I came. I'm a mess. It is a mess.
No, it's been a very kind of rough night.
I know, right?
All right.
It's not a meeting if one of us doesn't get our packet out of order at some
Yep.
point. of the meeting, so.
All right, well, if there are no questions for Karen, let's move on to technology.
Oh, I found it.
Oh, you found it? Did you have?
No, I'm good.
Okay, let's move on to technology.
Thank you, Mr. Chairman. If you have my report before you, and as soon as I can get out of here, I'm back to my office to work. So if you have any questions, let me know.
Questions for Deb? No?
No.
Oh, awesome. Thank you for the help with batteries.
It was a technological.
Yeah, it was totally your department. All right, principals report. So I guess we'll start with Mrs. Freetag.
I want to apologize to the board because I really can add, but the staggering news is that our enrollment is up.
Okay.
So instead of 172, it should say 272 as of that writing. And today I understand 11 more kids showed up. I don't know where these kids are coming from. I think
Wow.
Winchester. I think
That's
they're coming
big.
from Winchester. I know,
Wow.
we have a lot of kids desiring to come to school in Hinsdale.
Okay.
Tuition kids?
Maybe 1 or 2, I don't know for sure, but so we're doing the routine checking, verifying residency and so on and so forth, but it's amazing to me that I'm gonna have more than 50 kids in 9th grade.
Wow.
So
I mean, I say wow, right? Because like my class was like 10 times that, but for us.
I know, and
that's
I
a
think,
big-
I think the
that's a big
senior class will actually be 20 because one of these is a student who's going to get the, age out.
20 kids in the senior
I know,
class.
and over 50 in the 9th
And then
grade.
look at the next one, and then look
Yeah,
at the,
so it's,
look at it jump after that.
it's really hard to,
That's so weird.
Yeah, it's crazy.
yeah. So anyway, I'll address any questions you might have, and I believe you've met Chris.
Have met
Yeah,
Chris,
welcome,
yes.
And he's been working since he showed up, so this is good.
Well, that's kind of a good thing.
Yes.
That's the idea. That's the
Right.
general idea.
That was kind of the purpose of that. Yes.
And I am excited about the skill set opportunity. This is something the middle school teachers really wanted because of COVID, so that you'll probably see that in the plan fleshed out more. Parents have called, we've talked about it. We've had some good Zoom meetings with parents to talk about where are your kids' learning needs right now, what are you seeing over the summer? And I was very pleased with the number of kids who came in for help this summer. It was a lot of kids.
Yeah, it was.
It
And
was.
that's like really good.
Yeah, it is.
It was really good.
Good.
Questions for Ann? No? Nobody?
Thank you.
Thank you. Wayne, were you going to give us Joe's report, or are we skipping Joe?
Well, I could try to answer any questions you have, but I think he covered it pretty well, and much of it had to do with the opening, his reopening plan.
All right.
When is he back from vacation?
Monday?
Does anyone have any elementary questions that Wayne might be able to answer? No? All right, then we're on to the superintendent report.
You have my
Wayne?
report. Happy to answer any questions. I think we've covered the ground this evening, most of it as far as ESSER funds and reopening plan. We have a lot of work to do starting next Tuesday. I don't know if Karen, if you wanted to speak to.
So, yeah, I mean, our plan is pretty well in place. We have a lot of new faces coming in. I think that we're working on the mentor system, making sure they all have strong mentors. And we're actually going to invite some of the teachers that we knew last year, or people that were new, to be considered new this year too, because they didn't get that mentoring last year. So Karen has been guiding me through that mentor process. We'll meet with them on Tuesday. We would like to invite the board if they would like to attend that meeting. It's always nice to have a board person at the breakfast or more.
What date you say that was?
Tuesday morning between 8 and 9:30.
That's the 24th?
It's the 23rd.
23rd?
I believe.
I think it's the 20th.
Maybe it's the 24th, because Monday's,
24th,
yeah,
you're right.
right.
Yes, I took
Yes.
the day off for that.
Perfect.
So
you'll-
I will be here. What time did you say it was again? 8 a.m.?
8 to 9:30.
I will be here.
I may be here, I'll let you know after I talk with boss tomorrow.
So thank you. I just want to make sure the board had that opportunity. And that's pretty much covers my report unless you have questions.
Questions for Wayne? Holly?
I don't.
Jim? Julia? All right, let's get through these committee reports. Personnel, we have a meeting on Friday. Health and wellness.
We haven't met so far this year, but I will report when there's something.
All right, budget committee.
And the finance part, we'll probably be ramping up on that soon.
I was hopeful that we could get a meeting in early October and, go through a couple of things that I think would be important. Plus, we'll have a new BA to bring into that conversation. Would be important to get them going on that.
Yeah, and we'll have to get, another different board member on that too. So yeah, so cool. October. All right.
Is there a chair on finance committee?
Not yet, because we haven't met, right?
Right.
Okay,
I assume when we meet, well,
do the chair, all right. All right, staff development. That'd be you, because Kayla's not here. Nothing? All right.
We haven't.
Legislative.
Yeah, a couple quick things. First of all, Marianne texted me and she says, thank you to Tom.
Thank you to what?
Thank you to Tom.
I thought it was the messages.
I think she
Yeah,
maybe.
there are messages to the chat coming.
Yeah,
up,
we'll
too.
read through all that.
All right, so, okay, so back to legislation. The delegate assembly is going to be in mid-October. Yeah, October 16th on a Saturday. And there was an email that was sent out today with some of the motions that will be discussed and reviewed at that meeting. So we encourage everybody to look at that. Also, I did ask Ann to include at the end of our packet a document from the Department of Education. It's the State Department of Education, which was a frequently asked questions regarding House Bill 2, which was the right to freedom from discrimination in both the workplace and the K-12 educational space. And basically, it was the state's civil rights document regarding the bill in respect to how it impacts education. So if you guys haven't read that, you should read it.
Anything else?
No.
Can I add something to that one? Sorry, I guess, yeah. Just to piggyback on the delegate assembly, so we will need to pick a delegate. I don't know if Jim usually goes. We just need to let Ann know that if he wants to go. And the resolutions, we got the email last week, but then I think Barrett sent one out today because there was an error in one of the board names. But the board of directors meeting last week, we voted on it to, to approve, support or not support each resolution. So we just asked that at our October or we could do it in September or October, we would have time, but if everybody would take a look at those and I can forward them to Ann. I think we all probably got it if we get the NHS email, but if everyone could, or have it in our packet actually next month, Ann, if you could put the resolutions that went out today in the packet.
Yeah,
And thank you very much. And then we would just take a position on each one so that Jim knows which way to vote. He would vote on our board's will on each of the resolutions. And right now, the delegate assembly is planned to be in person, but it all depends on what LGC likes to do with the building. If they're going to right now, it's okay, but who knows in October. And one thing I just wanted to, that I did mention earlier with that Zoom with Secretary Cardona is one of the things that he encouraged is the schools doing now it's not a directive or anything, just encouraging. They want to get as many people in the community vaccinated, and I know they did this in Academy School in Brattleboro just yesterday, where schools can host or are hosting vaccination clinics like we did for our students, but hosted for the community. So I don't know if that's something we would want to look into or think about, but that's something that's kind of being encouraged to.
There's one tomorrow at HPC.
HPC,
If anybody's
Cool.
interested, they have the mobile van there.
Oh, awesome, cool. All right, so that's just one thing they wanted it to try to get as many places to do that, and they sort of, they found schools could do that, but and that's all for that.
And I would welcome being the delegate if the board wants me to be a delegate.
Yes,
Yes.
totally for it, 100%.
Absolutely.
Yes, yeah, right. So I
Just
will
wanna add
be a
that.
delegate.
Okay.
Yeah.
All right, HASP Advisory Board, I don't believe you guys met. Selectmen, so we talked about the joint meeting, so I'll get with the board chair over there and get some dates. The only other things of note have been the town, and I think a lot of you probably already know, town has had some infrastructure problems as of late. They've had problems with washout in River Road, broken water main, problem with the fuel station. They are also getting relief funds, from the state as far as like the COVID funds and all that. I don't know what the washout is there, but I think that they're pretty much spending, is it like $300 and something thousand? They're gonna be spending all of that on the recent infrastructure problems, I'm pretty sure.
And I don't think that the fuel pump at the town affects us at all. Right?
Well, we fill our vehicles at the town pumps.
Oh, we do? Okay, I'm sorry, I got that wrong.
Right. And I don't know the status of the fuel station as of now. This was like weeks ago. Is it repaired now?
Built again, so.
Okay, all right, perfect. Yeah,
And,
so
Sidewalk project will start.
and the sidewalk project starting soon too, yep. Oh, that was approved like years ago.
Well, no, I'm talking about the one at the town meeting for the one by the school.
The one that's gonna come, there's one that's gonna start at like kind of L&O down that way, all the way up here, River Road up to here.
Oh, yeah, no, that's not.
Yeah, they put,
I'm talking about the one that was at town meeting. with-
no,
Oh,
School Street, no, that
yeah,
failed, that failed.
Right, that's right.
Yep.
So this is downtown.
That basically goes from River Road up to here. It's part of Safe Routes to School. The town had approved it and then put money away for it for X amount of years. Jill ended up getting, I think, more grant funding than she originally anticipated. And then it was approved to expend funds out of that trust. So that is going to be starting. I think it already went out to bid and all that. Yep.
The construction manager stopped here the other day.
Oh, good.
Said he was gonna be starting it on Monday.
Perfect. Great. Okay.
If its pipe order arrived.
Well,
Yeah,
that's
so
that's a big if. All right, facilities.
We have a meeting on Friday.
Community connection, we kind of just did that. Tuition committee. No.
It's just on there.
Yeah, just on there. Behavioral support team.
Kayla was the chair of that. That would be something. When
So
you
we
get a
know to
new
deal with that.
board, we typically meet quarterly.
All right, joint
Yeah,
loss.
we haven't met for a while.
Joint loss, I don't remember, and did we meet?
We
before
met
the
in
last
June, we
meeting?
met in June, but not
Before the
week
meeting?
before the meeting,
Okay,
so,
so then we're good.
yeah.
Okay, Ian, would you mind just reading the Zoom chat comments just so we get all that in?
Thank you, Holly. I was thinking about what was being presented and thought instructionally, and students were seated, they could use the idea of a mask break, but in other areas of the school, passing times, etc., mask would be necessary. That may have not been clear in what I said, however, that was my intent.
Okay, thank you.
Katie Leonard says, thank you, Tom. April Anderson says, thank you, Tom, for all you've done. Lindsay said, wait, this is Tom's last meeting? Bye, Tom.
Okay. All right,
That's
is that it? All right, we do have some non-public items, so I need a motion to go into non-public.
So, second,
All right, motion a second, roll call.
yes.
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 All right, so we need, I need,
That is what.
go get chocolate.
Yes.
We definitely need